For anyone in the room who does not recognize me, I'm Lynn Christensen. I'm your host this evening. In attendance, we have quite a few dignitaries. At the front table here, we have Dr. Benjamin Chan. We have Clark Frise. Did I do it right? Clark will work. And we have Lisa Morris. In the audience, we have our town council, as well as our town manager. We have Nancy Harrington, Bill Boyd, Jackie Flood, Pete Albert, and town manager Eileen Cabanel. I know our assistant is roaming around here somewhere, Paul McCallie, hiding in the back. We also have our state representatives, Dick Hinch, the majority leader, Dick Barry, Janine Notter, Tony Pellegrino, Bob LaRue, Chris Christensen, Josh Moore, and Dan Hines. We have Senator Daniels here somewhere. I know I saw him earlier. Thank you. And we have the MVD reps. We have Ron Miner and Jill Lavoie from the office. We also have Lon Woods, Jack Balcom, and Tony Pellegrino, who are commissioners. So that's your dignitaries, so to speak. We have taken a sign-in here for anyone who wishes to speak tonight. We've also taken some questions in writing. I'm not going to take any more, but one that came in earlier, we can do this. We've got a presentation that the state is going to be going through. Once we're done with that, we're going to go to the questions that have been submitted in writing. And then anyone, if we have time left, anyone who's interested in speaking, who signed up on one of the sheets that we have up front here, we'll be recognizing you to ask questions or clarification. Understanding that some of these issues can generate some strong emotions and that there can be differing opinions, I've always been proud of this town, and I would expect that you'd be polite, courteous, and respectful to others. You've always been so. I expect nothing different tonight. So, proceeding on, I'm going to turn the mic over to Kurt first. Clark.
Good evening. Thank you for joining us for this informational meeting. I want to thank the Town Council for inviting us and hosting us, and thank you for hosting me for office hours the last month. We do also have a representative here from St. Gobain. They're not here to answer questions. They're here to take notes, get personal observations. St. Gobain has certainly heard from me about your level of concern. This gives them a chance to hear that same input from one of their own employees. We got a lot of material to cover. I know there are a lot of questions, so we'll try and move forward in an expeditious fashion. That's the agenda? No, it's not. That's the agenda. It's pretty simple. We're going to talk a little bit about DES as far as what's been going on, where we're at in testing, and the couple of hanging items that are still out there. Then DHHS is going to take over and talk a little bit about health effects, and then talk about the blood tests that were done and the results from that. It's a good picture. It didn't turn out well on the screen. I apologize. So the big issues as far as the water system here, especially for those of you who are customers on MVD, are wells 4 and 5. 4 has consistently tested above state standards. 5 has occasionally tested above state standards. They were both red tagged and taken offline last year, and they are not supplying any water to anybody at this time. The real issue with that is we need them to come back online into the MVD system. They are primary producers. They're counted on for about 800,000 to 1 million gallons a day at peak. So these are pretty important wells. So where we're at right now, St. Gobain did fund a 30% study design that has been completed. That was done back in June, July. That was presented to them. There were some discussions back and forth as far as that design. There were also some other issues that were hanging, that were getting in the way. We had a meeting on September 7th, got a number of those issues clarified and sort of cleared out of the way. Since then, there have been continuing discussions between the lawyer for MVD and the lawyer for St. Gobain, and I'm told by both sides they're making good progress in trying to get to a good resolution. So hopefully within a few weeks, there will be some good news on that front. And I apologize we don't have it as of tonight. I don't know whether the remote's working or not. So the overall quality in the MVD system I know is a real concern. One of the things that we've been doing along with Pennachuck is monitoring at Cabot Preserve. Cabot is up in Bedford, but it's supplied by MVD water. So it's a good way to sort of get a sample of what's going on in the overall MVD system, and it's at an edge. So any of the wells that are contributing have already contributed by the time they get to Cabot Preserve, so it's a good measure. That's been getting measured so far 66 times since the investigation began. The range that we've seen is 3 to 60 parts per trillion. Before you get excited about the 60 parts per trillion, that was April of last year before wells 4 and 5 were shut off. Since they've been shut off, the highest we've seen is 25 parts per trillion. On average, for the entire year, it's been 16 parts per trillion. So the water in the system that people are drinking today is around 16 to 25. Well, actually, the average is 16, the high is 25. You have to actually lift it off the table to get it to work. So the wells that go into the MVD system are also separately monitored so we can see what's going on with them. And the primary wells are 2, 3, and then wells 7 and 8 are actually combined because they have a manganese problem. So they go through something called green sands, which takes manganese out, also helps with iron, I think. And we've been monitoring those through time. There were some early spikes where we had a couple of issues with the lab. You'll see a spike back in September of last year. We think that was a lab issue because it's not the chemical that Saint-Gobain put out, and it showed up suddenly and then went away again. So we think that was a lab issue. On average, things are staying pretty steady. We did see a little rise last summer and fall with the drought. When we got out of the drought, levels came down. We are a little bit concerned with 7 and 8. We are seeing it coming back up. We are headed back into drought, unfortunately. You might have noticed until yesterday we hadn't gotten rain in a while. We are monitoring both the well and the monitoring wells around there to make sure if there is an issue we spot it early. But we did want to put out there, we do see 7 and 8 have come up a little bit. They're not quite as high as they were last year, but we are monitoring that. So beyond that, we then get into the question of people who are still on wells. And there are a number of neighborhoods that have been highlighted, and they've been put on bottled water this year. Yeah, I was afraid it wouldn't show up. So if you see where I'm putting the red spot, there's an arrow up there. It's sort of hard to see. That points out the neighborhoods that are, as we say, in dispute. And this highlights those neighborhoods. So where we're at with these as far as progress is we've highlighted these Saint-Gobain. We've told them their responsibility. We did that through the AG's office. They have some technical data that has had them disputing that. We, again, on the 6th, since they were in town, we had a very forceful meeting between the AG and their council. I think we made our point rather well. And since then, we've had a number of fruitful discussions. And I think, again, I'm hoping that we will have good news within a month. That those neighborhoods will be connected to MVD water at Saint-Gobain's expense. Unfortunately, given the season, that would be in the spring. In the meantime, everybody in those neighborhoods is on bottled water. It's Monadnock spring water. We do test it. We've had 3 rounds of testing, blind testing. They didn't know where it was coming from. We just grabbed a gallon jug out of somebody's delivery, and every time it's non-detect across the board for all the PFCs. So where we're at in progress is we've had, and this is sort of the range of activities. The first part is just discovery. We discovered there was a problem, and we went out to discover how far and how broad that problem was. Unfortunately, part of what we found was that MVD did have contaminated wells, and those had to be taken offline, and that's had a serious impact. And Dr. Chan will talk more about that. We go into emergency response mode. That's getting these measurements done, getting people on bottled water, getting communications out to folks. We're still in that mode. We are still investigating. We are still testing. We are also at the edge where we think we found the edge. We're doubling up on tests just to make sure between drought, rain, drought, are we seeing any changes? We then go into a site investigation, and this part is going to take a long time. This is the largest contamination area we've dealt with. It's just a huge area compared to what we normally do. Normally you'd have a small business, they've released something into the ground, there's 3 or 4 houses around them. It doesn't take that long to investigate and come up with a solution. In this case, we're talking many, many square miles that are going to have to be figured out as to how we do remediation, how we do monitoring, and that's going to take a longer time until that final plan is done. We then go down into a groundwater management program, and that is both remediation monitoring and a groundwater management zone, which will actually be a permit that we'll issue to St. Gobain, and they will have responsibility within that permitted zone to follow through on the actions on their remedial action plan. But again, that's going to be a while until that is even proposed, let alone agreed to. So this will be an ongoing communication because that activity will not get done quickly, just because of the complexity and the size of the zone, if nothing else. So that's the short version of update. I'm sure there'll be more questions because I probably didn't cover the details you wanted, and we'll get to those as we go through. We have a lot of DES staff here. I know a lot were answering questions beforehand, but we'll be glad to answer questions when we get to that part. With that, I'll hand it over to Dr. Chan. Oh, no, I won't. I'll hand it to Lisa Morris.
Yes, everybody. Oh my goodness. I have a big voice. My name is Lisa Morris. I'm the Director of Public Health at the New Hampshire Department of Health and Human Services. I speak for myself and many of the staff who are here from Public Health that we are pleased to be here with you tonight. As you know, we're here to talk to you about PFCs, as Clark has just been talking about, and the results of the blood testing in your district. It's important for you to know that everyone at DHHS, DES, and the Governor's Office shares your concerns about PFCs and their potential impact on your health and the health of your children. We know that it took a long time for you to receive the results of your blood tests. We needed the time to do complex analysis and needed all the blood results before analysis could begin. That's why it took so long. We know that the long wait was difficult for all of us, especially for you, but we wanted to get it right. As some of you know, individual results were sent out on Friday. A lot of information, if you received those results, if you were part of the study, a lot of information was sent to you. Although we tried very hard to keep it as simple as possible, we know that the report may not be easy to understand. But we included with the packet a list of phone numbers and websites for you to resource, so please use them. We understand that even though the community exposure assessment represented the MVD community, we know that those who did not receive a blood test may want one. We did an analysis of what it would cost if we were to provide free blood testing for you, for this community. And we took a small sampling, well, what we consider a small sampling, considering the size of the district, of about 5,000 residents, and it would cost over $1 million to do that. So what we don't want to do is stand in the way of you working with your healthcare providers to make the decision to do the medical monitoring that you want, which includes blood monitoring. So what we've done is that we have started a partnership with the New Hampshire Medical Society, and they enthusiastically agreed, not just agreed, but they enthusiastically embraced the partnership between us and them to provide continued outreach to healthcare providers. We've tried hard to do that outreach through what we call Health Alert Network, health alerts in our Health Alert Network, and also through webinars, but we haven't been able to reach the masses. And so that's what we really want to do. We want to provide education to them on PFCs and to review medical monitoring practices with them. And we're working, as I had mentioned, with the New Hampshire Medical Society to do just that. The other partnership that we've recently established is with the Merrimack Citizens for Clean Water. We recently met with representatives, advocates, Lorene, Carol, Kristen, and Catherine. We reviewed the health survey that they and others did, just a tremendous number of surveys that they were able to complete, and this information will provide us additional facts that we can use in our ongoing work with you. We plan to continue our relationship with them as they have agreed to assist us in figuring out how to best communicate with you in an ongoing way, what I call continuous communication. Oh, that's interesting. Also, this evening I was talking to Representative Berry and others, and they suggested maybe that we should think about use of public access. And so we're going to think about that as well. So I appreciate that conversation and that offer. So we feel fortunate that we have met with these Citizens for Clean Water advocates, and will continue to partner with them on a variety of different tasks, including communications. I want to talk a minute about cancer rates. We are in the process of finalizing our cancer incidence report for Merrimack County, where we looked at incidences of 26 cancer types. I'm happy to report that the rates are not higher in Merrimack than in the rest of New Hampshire. We're finalizing the report right now, and it should be available to you soon. Additionally, we will continue to do this cancer monitoring. Let's talk a moment about research. We have written a letter and communicated and continuously communicated with the federal government, various levels of government, regarding the need for research, and offered to share our experiences and our data with them. These discussions should and will continue, and you as well should be reaching out to our federal partners and our delegation. Lastly, I want to mention that we, like you, as I had mentioned, are concerned with these emerging issues related to chemical contaminants. And we're starting an internal environmental health assessment to see, in partnership with DES, to see where our capacities are and are not, and to identify needs. One of the biggest needs that we know we have is for an environmental toxicologist. And so we're working very hard to look at funding and to look at possible positions and reclassifying positions, enabling us to hire this particular professional. So with that, I would like to introduce Dr. Ben Chan, our state epidemiologist and physician, and he is here for you today to provide information about PFCs and to review the results of the MVD exposure assessment. Dr. Chan.
I'm okay, thanks. Good evening. Can everybody hear me okay? Can everybody see me okay? All right, I'm going to stand up because I tend to do a better job projecting my voice when I'm standing, and also I'm going to be pointing to the screen. So thank you all for coming tonight. I know that there are probably some new residents here who were not in the community, or at least not at the meeting last time the Department of Health was in Merrimack talking about perfluorochemicals, or PFCs. And so I'm going to talk for about 20 or 30 minutes. These slides will be posted online after the presentation. So please don't feel like you have to snap pictures or take furious notes. These will all be available to you. But I'm going to start by talking about PFCs and a little bit of background on PFCs and make sure I'm pointing in the right direction. You're going to hear me mention the organization ATSDR. This is an agency within the Centers for Disease Control and Prevention that responds to and helps respond to issues of environmental contamination in states and in communities. ATSDR stands for the Agency of Toxic Substances and Disease Registry. You're going to hear their name mentioned again because the PFC issue is really a growing national problem as we find more and more communities around the United States that have been impacted with PFC contamination. And so we have been talking and coordinating with them around trying to look at this on a national level. This is a graphic from them, and this is hopefully a little bit helpful in clarifying some of the terminology. When we start talking about PFCs, it becomes somewhat of an alphabet soup because there's so many different acronyms and abbreviations that are thrown around. PFCs, or perfluorochemicals, is an old name for a group of chemicals. The newer term is perfluoroalkyl and polyfluoroalkyl substances. And you can see this is a tree diagram where you can see that PFCs, or PFAS, is the general term for a group of compounds. And then when we start talking about specific compounds like PFOA, PFOS, these are specific types of PFCs. So PFOA is the main one that we're going to talk about tonight. The name for PFOA is perfluorooctanoic acid, which is why we abbreviate it PFOA. So the bad news is that PFCs and PFOA have been used extensively over decades in a variety of both commercial products as well as industrial uses. And this is a table that I've put up before. On the left-hand side, it shows a number of commercial products for which PFCs were used. On the right-hand side, it shows a number of industrial uses. And you'll notice that various home products have been used that contain PFCs, so anywhere from Gore-Tex fabric to Scotchgard sprays to dental floss and Teflon. So unfortunately, we have been exposed to PFCs. Now, exposure to PFCs is mainly through, let me see, sorry about this, my slides are a little bit out of order here. So most people have been exposed to PFOA specifically through our everyday commercial products. Now it's important to note that since 2006, the Environmental Protection Agency, or EPA, has been working with the major manufacturers of PFOA through what they call the Global Stewardship Program to phase out use of these chemicals in the United States by the end of 2015. Now that was 2 years ago, and by all reports, the EPA and these companies have been successful in phasing out the use of PFOA specifically in commercial products. So the good news is that individuals' exposure to PFOA has been decreasing, and so we see this in studies of the general U.S. population where they measure the general population and have found PFOA levels in the blood to be decreasing. Now, exposure to PFOA in drinking water, however, as is being identified around the country, will lead to higher than average levels of PFOA in a person's blood compared to the general U.S. population. So PFOA exposure is mainly, and other PFCs, is mainly going to be through oral ingestion. So through consuming contaminated food, contaminated water. PFOA used to be used in a variety of food packaging. That has since been phased out of use. There are still PFC compounds that can be found in various products around the home. So some of these PFCs are used in stain-resistant carpets, and so it can contaminate dust, for example, and people in their home environments ingest dust. Infants and toddlers and children, through hand-to-mouth exposure, can introduce PFCs into their body. And so exposure through breathing PFOA emissions, this is an issue that has come up in past discussions with the community. It's possible to be exposed through PFC or PFOA emissions and breathe them into our lungs and then be absorbed into our bodies. That is not thought to be a major source of exposure except for limited population of individuals, occupational workers, for example, who are working around PFC or PFOA fumes all the time. We're going to talk a little bit more about this later. The issue of dermal absorption or absorption of PFCs through the skin has also come up. And while it's possible that small amounts of PFOA could potentially be absorbed through human skin, it's also not thought to be a major route of exposure to PFCs. So the big question in all of this is, we have, the majority of the U.S. population have been exposed to these chemicals. People who drink contaminated water, we have found in our own testing and in testing around the country, tend to have higher levels of exposure in their blood. So the big question is, what does this mean for someone's health? The long-term health effects are unclear, but there are a variety of health outcomes that have been and continue to be studied, including this long list here. So there has been some evidence that PFOA and other PFCs could potentially affect hormones in our body, liver enzymes, cholesterol levels. There is some research ongoing into the effect of PFOA on reproductive development and puberty. There is some newer emerging evidence that PFCs and PFOA could potentially affect immune function, specifically looking at antibody response to vaccination. There has been a study looking at the effect of growth of PFOA and other PFCs on growth and development. And then one of the major concerns has obviously been around cancer. And so there has been study into a number of cancers, and there are 2 or 3 specifically which have some evidence for a connection between PFC exposure and cancer, specifically prostate cancer, kidney cancer, and testicular cancer. Now, there's also an important study which you will likely hear about if you haven't already, which is called the C8 Health Project. This is a large study that was conducted back in 2005, 2006 in an environmentally exposed population in West Virginia and Ohio, what they call the Ohio River Valley. This was a community, or actually a group of communities, that were exposed through a DuPont chemical plant which used PFOA in the production at their facility. And so C8 is the term, or an abbreviation for PFOA, because the actual molecule has 6 carbons in it, so C8 is an abbreviation for PFOA. Now this is one of the largest and most important studies of health effects in an environmentally exposed community, largely because of the size of the population that was studied. Through the C8 Health Project, there was a panel of 3 independent environmental epidemiologists that reviewed the existing science at the time and also studied the exposed population in the Ohio River Valley area. And they made determinations about whether there was a health link or not between PFOA exposure and a whole list of health outcomes that were studied. They came out with these link reports and assessed whether there was what they called a probable link or not. And a probable link was defined as more likely than not that among class members a connection exists between PFOA exposure and a particular human disease. So the funding for this came through a lawsuit settlement, but the science was carried out by 3 environmental health epidemiologists that formed the science panel that came out with these link reports. So the C8 Science Panel link reports, they categorize them as no probable link. So these are all the health conditions on the left where they did not find a probable link between PFOA exposure and health outcomes. And on the right are the, I believe, 6 health outcomes which the environmental epidemiologists felt that there was a more likely than not or possible link between PFOA exposure and these health outcomes. Now, since this time, there have been other studies that have come out, and unfortunately, there's still, so even though the C8 Science Panel and the C8 Health Project put out some very important and good scientific study, it is still one study of a population, and so there have been other studies that have since come out, and unfortunately, there is uncertainty about what PFC exposure means for someone's health. For several reasons. One is that associations that have been found between PFOA and various health outcomes are often not consistent between studies. Even though some studies have found associations, such as the C8 Health Project, have found associations between PFCs like PFOA and health outcomes, it doesn't necessarily mean that the PFCs caused those health outcomes. So there's a difference between finding an association and proving causation. And in some studies, the identified health impacts are not necessarily clinically or biologically relevant. So there's further study that is ongoing. There's further study that is needed. Having said that, though, there's understandably, I think, valid concern in all the communities that we have talked to that have found these chemicals in their drinking water. There's understandable and valid concern about what these chemicals mean for an impact on someone's health. And so we are trying to work very diligently to provide answers and to provide scientifically based information and, in fact, to advance the science around health impacts and PFC exposure. So that's a little bit of an overview. Let me jump into the main reason we wanted to present tonight, which was the results of the Merrimack Village District, or MVD, Community Exposure Assessment. So to give you a little bit of an overview, as I'm sure you're all aware, in March of 2016, or around that time, PFOA was discovered in several southern New Hampshire communities around the St. Gobain Performance Plastics facility here in Merrimack. As Clark has mentioned, the MVD public water system is supplied by multiple individual wells that are blended together prior to delivery of the drinking water to the tap. 2 specific MVD supply wells, which are wells 4 and 5, which Clark has previously mentioned, were taken offline around June of 2016 when they tested near or above the 70 nanogram per liter, or 70 parts per trillion lifetime health advisory level that has been put out by the Environmental Protection Agency. The MVD water supply wells are currently providing drinking water that is below this 70 part per trillion EPA lifetime health advisory level. Now, the New Hampshire Department of Health and Human Services launched the MVD Community Exposure Assessment in the fall of 2016 with the purpose of trying to evaluate and provide more information to this community about the levels of exposure to PFC, specifically PFOA, amongst the residents that are served by the Merrimack Village District or MVD public water system. Some of the goals of this were to evaluate exposure by testing blood, serum concentrations, what I'm going to refer to as blood levels, from a random sampling of residents in the Merrimack and Bedford areas. These are the residents who are on the MVD public water system. Using a random sampling approach is the recommended scientific approach so that the findings of the test results can be generalizable to the broader population served by the MVD system. So when we set out to do the MVD community exposure assessment, we sought to include around 200 customers or 200 residents who got their public drinking water from the MVD system. 200 residents was determined to be the target sample size in order to be representative of all MVD customers and to be comparable to other populations that have been tested around New Hampshire and around the United States. So over the course of a number of months, we ended up recruiting 217 individuals, so just over our target, to participate in this community exposure assessment, and these 217 individuals represented about 132 households. So we actually invited the household, not just a single individual. All participants were required to register online, complete an exposure assessment, which asked about various exposure variables, which I'll talk about, and then have a blood sample drawn at a participating blood draw center. So we went through actually 4 rounds of recruitment over about 7 months in order to capture these 217 individuals. We invited a total of about 1,000 residents to participate. 217 responded, as I mentioned, and completed the blood draw process. So there was about a 22% response rate. The final blood test results were returned to us from our testing lab in August of 2017. We took the next month to 2 months to analyze and then release the results just last week, and then we're having a community meeting this evening to talk about the results. So the results. A brief comment about terminology here. For those of you who picked up the handouts when you walked in, and for those of you who had your blood tested, you'll see some of these terms used throughout the report and throughout the presentation. We don't want them to be confusing. Geometric mean you will see mentioned. The geometric mean is simply an average. It's the middle level found, or the middle estimate of blood levels that have been found in the population that we tested. You'll see the 5th percentile sometimes talked about and listed. The 5th percentile is the lower end of blood levels, which a minority of people tested below. So they're the lower percentage, 5% of individuals it's the 5% of individuals in the community who tested below this level. I'm going to refer more to the 95th percentile. The 95th percentile refers to the upper end of blood levels which most people tested below. So the 95th percentile is the level at which 95% of individuals in the community tested below. And then you'll see blood concentrations measured in micrograms per liter, which is sometimes abbreviated with this little U-type symbol, grams per liter. And you'll see that throughout the presentation and the report. So these are some of the exposure variables that we evaluated. These are some of the factors that we questioned about when we recruited people and sent out a survey, and that I'm going to talk about here. So I'm going to first start by looking at the overall distribution of the blood test results and how they may compare to other communities. We're going to look at demographics, specifically age and gender, length of time living at the current residents in Merrimack or Bedford, the amount of self-reported water consumption per day, and then location of residents from the St. Gobain plant and MVD wells 4 and 5. We looked at differing levels by location within the town of Merrimack. Now, there's going to be a lot of comparison graphs that I'm going to throw up, and the reason for that is because it's important to remember that blood test results do not have a normal versus abnormal result. There's not a level that we know will cause or contribute to a health problem. And so when we interpret blood test results, oftentimes it's done relative to other tested populations, so it's a relative comparison. Hopefully this shows up okay in terms of the color. So this is an overall summary looking at the average of various PFC levels, actually 3 different specific PFCs, PFOS, PFOA, and PFHXS, through the various populations that we've tested. And so you'll see the various tested populations listed here. So PEAS 2015, we started off doing blood testing on the PEAS trade port because of, again, drinking water contamination back in 2015. We opened that testing back up in 2016 and 2017 when we also opened up PFC blood testing for individuals in southern New Hampshire who were on private wells in areas that tested above 70 parts per trillion. And then in the middle here, you'll see the MVD, or Merrimack Village District Community Exposure Assessment, which are the results that we're talking about this evening. And then the last 2 bars are the general U.S. population that were tested in 2011-2012. That used to be an old comparison, and in January of this year, the CDC came out with some new comparisons for 2013 and 2014. So, for example, if you'll notice these light bars in the middle for PFOS, the bar that says 5.5, that is the average level of PFOS found in the MVD community exposure assessment, and it is similar to the general U.S. population. Right? Going over to the right-hand side, PFHXS, again in the middle, the light whitish bar, 1.3 micrograms per liter was the average PFHXS level found in the MVD residents. This is similar to the general U.S. population that was tested both in 2011 and 2012 and 2013 to 2014. So the levels of PFOS and PFHXS, which have been more of a concern in the PEAS trade port population, you'll notice the higher blue bars at the ends, are not as much of a concern in the Merrimack Village District community. The main contaminant that has been found in the MVD public water system was PFOA. And so you'll see that, again, the white bar in the middle at 3.9, the average PFOA level in MVD participants was 3.9, or about 4 micrograms per liter, compared to the general U.S. population, which tested around 2. So there is a statistically higher average level of PFOA for participants in the MVD exposure assessment compared to the general U.S. population. Now you'll also notice that the PFOA levels in the MVD participants are similar to the average PFOA levels in our southern New Hampshire population that was tested. These are individuals on private wells. We have the benefit of having private well water tests, and so when we compare these 2 populations, the MVD participants on public water compared to those in southern New Hampshire on private wells, the average and 95th percentile levels for MVD were most similar to blood levels in other southern New Hampshire residents whose private drinking water wells tested between 40 and 60 parts per trillion of PFOA. Right? So we were trying to separate out the comparison a little bit in these graphs. We also looked at 95th percentile levels by community. Again, these are the same communities on the prior graph I just showed you. And you'll see again that the 95th percentile, remember that's the level that most people tested below, was higher in the MVD population compared to the general U.S. population, but significantly lower than those in southern New Hampshire. And the reason for that is this graph. This is a graph that is showing the number of individuals in the MVD community exposure assessment by PFOA blood level. And you can see that there's a relatively tight grouping of people that tested at about 10 or below. In many of the other populations that we've tested, there are many more people at these higher levels scattered throughout, or what we see as little points throughout the graph. So when you go back and look at the 95th percentile levels by community, you can see that even though the average PFOA level in the MVD participants is higher than the general U.S. population, the spread of results is not as great as, for example, in southern New Hampshire, where you have some very low private well test results and some very high private well test results. So when we look at the individuals by PFOA blood level, as you look through the report, you will see charts like this one in the lower left-hand corner, which shows the number of people by the PFOA serum concentration. In the upper right-hand corner, I have simply graphed the percentage of individuals that have tested by PFOA blood level range, and you can see that about 70% of people in the MVD, of the MVD participants, tested below 5 micrograms per liter of PFOA in their blood. And when you look at this distribution graph, which I just showed you, I apologize, I'm jumping around a little bit. Again, going back to the graph, looking at the number of individuals that tested at varying PFOA levels, you can say here at 3.9 micrograms per liter is the average level that was found of MVD participants, and then here is the 95th percentile, the level at which 95% of individuals tested below, which is a level of about 10 micrograms per liter. So when we look at comparison to other tested populations, this graph at the top shows multiple communities that have been and have a known exposure to PFOA. At the top you have 3M workers who were occupationally exposed at a PFOA facility. You can see the C8 Health Project and the average PFOA level in the community. Hoosick Falls, New York recently underwent their own testing because of community contamination around a Saint-Gobain facility in their area. Bennington, Vermont also has initiated PFOA blood testing because of contamination around another Saint-Gobain facility. And you can see that here's MVD higher than the general U.S. population, but substantially lower than some of these other exposed communities. Some of these other environmentally exposed communities have found average PFOA blood levels in the range of 10 to 30 plus micrograms per liter in their individuals. Certainly occupational workers that have been exposed through industry have much, much higher levels. So we also looked at the average PFOA levels by age and gender. You can see this is a chart that is in one of the handouts. We look in the left-hand column you have gender, you have age breakouts. In the middle column you have the number of people in each group, and then you have the average PFOA serum concentration by group. And so there was not a difference in PFOA blood levels that were seen by gender. You can see in males the average PFOA level is 4.1 versus 3.8 in females. However, there was a difference in PFOA level by age, specifically that there were increasing levels seen with increasing age. I have graphed this out here, and you can see that comparing those who are 0 to 19 years old versus 20 to 39, compared to 40 to 59 and 60 plus, that there's a general trend for increasing average PFOA blood level by age. Here is the overall average of 3.9 that I have highlighted before. And this is actually something that has been reported in the science, that as individuals get older, they tend to have more exposure to PFOA. We also looked at PFOA level by residential history, specifically those who lived at their current residence for less than 10 years and those who lived at their current residence for 10 or more years. And the average PFOA serum or blood levels were very similar between the two groups. So there was not a significant difference in PFOA blood levels when looking at residential history. We evaluated self-reported water consumption, breaking it out by cups of tap water consumed per day. This was self-reported on the questionnaire that we had sent out. You can see in the middle column the number of people that responded in each category, and then on the right-hand side you have the average PFOA blood level by self-reported water consumption, and you can see that that the average PFOA levels increased with increasing self-reported water consumption. And that's highlighted here in this graph. Again, the overall average was 3.9, and so you can see that those who drank 8 or more cups of water a day had a higher PFOA blood level compared to people that drank 0 to 3 cups of water per day. Now, the last thing I want to mention is we looked at PFOA blood levels based on residence and distance from the Saint-Gobain plant and Merrimack Village District Wells 4 and 5. So let me jump ahead just one slide, and you can't see this very well. This is an old map that DES put out. I pulled this off their website because I think it pretty well shows. Here in the middle is the Saint-Gobain plant. You can see the first purple ring here, which is a mile radius from the plant. The second purple ring is a 1.5 mile radius from the plant, and then just to the southwest of the Saint-Gobain plant, you'll see MVD wells 4 and 5. And so we attempted to look to see whether there were differing PFOA levels, blood levels, based on where somebody resided, whether they were within this 1.5 mile radius of the Saint-Gobain plant, whether they were within a 1.5 mile radius of the MVD wells 4 and 5, or whether they were just totally outside of this area. And so going back, what we found were that those living within 1.5 miles of the Saint-Gobain plant had a higher PFOA blood level compared to those living more than 1.5 miles away. We attempted to also assess whether proximity to wells, MVD wells 4 and 5 had any effect, and this is something that remains uncertain and unclear. But you can see that for those in the bottom row here that lived more than 1.5 miles from either Saint-Gobain, but actually more than 1.5 miles from both Saint-Gobain and wells 4 and 5 had an average, this group had an average PFOA blood level of about 3.6. For those that lived within 1.5 miles of the Saint-Gobain plant and also within 1.5 miles of MVD wells 4 and 5, the average PFOA blood level was substantially higher. So this is something that I know there has been concern in the community. What about air emissions? Are air emissions from the plant possibly contributing and leading to more exposure? This is something we are very interested in looking more into because we don't have a clear explanation right now for why levels are higher, whether it's potential air exposure or whether there's some other pathway of exposure that could be contributing to these higher PFOA blood levels. So, in summary, residents on the MVD public water system had higher levels of PFOA exposure compared to the general U.S. population. This is probably and likely due in part to the levels of PFOA that have been found in the public water supply, specifically from MVD wells 4 and 5, which, as Clark mentioned, are shut off and have been shut off for, I believe, over a year now. We can't entirely exclude other sources of exposure. PFOA blood levels were lower than levels seen in other PFOA-exposed communities around the United States, including more recent testing that has been done in Hoosick Falls, New York, and Bennington, Vermont, around their areas of contamination around their Saint-Gobain plant. And unfortunately, the science is still not at a point, as I mentioned, where PFOA blood levels still cannot tell a person if any health problems might or have occurred because of the exposure. And this is something that we are very interested in partnering with community members and federal partners to try and advance the science on. So what are the next steps? So as I just mentioned, we're working with DES, the Department of Environmental Services, to better understand the differences in PFOA exposure by location and distance from the Saint-Gobain plant, as well as MVD wells 4 and 5. I know this is going to be of interest to the community, and this is also of interest to us to learn more about why we're seeing this. The CDC's Agency for Toxic Substances and Disease Registry, or ATSDR, we have been working with them and requested that they perform a health consultation for exposed communities around the Saint-Gobain plant, including those on the MVD public water system. They are in the process of doing that currently. We are working with our federal partners, such as our congressional delegation and ATSDR, to try and fund and have ATSDR conduct a national health effects study that includes not just the Pease trade port, but also our communities that have been impacted here in southern New Hampshire and in Merrimack specifically. And as Lisa mentioned earlier, we are working with and have started working with the New Hampshire Medical Society to improve communication with and education of New Hampshire healthcare providers about monitoring for potential health effects after exposure to individuals in the community. I know that of primary concern is the question that we have heard over and over again, which is, what does this exposure mean for my health? And that is, as I mentioned, something that we are actively trying to get information to the community as well as healthcare providers so that health concerns can be efficiently and fully addressed between someone who's been exposed and their healthcare provider. And I will point out that since I think we were last here, ATSDR has put out a number of new documents within the last several months to year. Specifically, ATSDR has put out some healthcare provider guidance specifically for clinicians around monitoring health effects in someone who's been exposed to PFCs or PFOA. And they have even put out some continuing education for clinicians. And so if you are talking to a healthcare provider and they are not familiar with PFOA and these chemicals, we have put out many resources around this, and ATSDR has also more recently put out some up-to-date information for healthcare providers. So with that, let me end. I do want to point you to additional resources online. All of the handouts that you have picked up today on the table are also available on our main DHHS website. We also have data on other exposed communities, such as people on private wells in southern New Hampshire, individuals exposed on the Peace Trade Port. We have put this on our data reporting page. We will also have MVD blood testing up on this page soon. And then I would point you to the ATSDR PFC or PFAS website where you can access some of the information that I've already highlighted. So with that, let me actually leave that up and end. And I think the plan is to open up for questions.
Thank you. I'm going to have to deal with the light situation until I can get maintenance down here. I've combined a number of these questions because they're very, very similar. A general question about if the blood hasn't been tested, is there a way of someone in town getting their blood tested?
So this is a good question and a common question. I know that one that is probably shared by multiple individuals here. Unfortunately, this is not a common blood test. It's not something that you can just go to a laboratory or hospital and a healthcare provider will know how to order. We have contracts with certain labs that do the testing on our behalf. This is not testing that we do here in New Hampshire. Many of these labs that we have worked with do not take blood samples from healthcare providers. With that said, however, there are, I want to say, 2 or 3 labs that are out there that are willing to take blood samples from individuals. A couple labs that we have previously put their names and contact information out there. But I'll mention, as Lisa has mentioned before, at this time, blood testing is not open to the entire MVD community. This is something, obviously, that we understand is a request and a concern, and something that we are actively discussing. However, there's some resource issues around being able to open up testing for everybody that may have been exposed at this time. I don't know, Lisa, if you want to say more about that.
Yeah, I mean, we're in a quandary. We're in a quandary about this because we understand that you want your blood tested, you want the PFC, and once we realize what the cost would be, we're like, I don't want to say what, kinds of things that we said out loud, but we said, is this something that we can afford? We have a $60,000 in our emergency testing fund, and so we looked at other options, and so if we cap it at a certain level, so let's say we do 1,000 people, there will be people who will be very upset And so is that okay? So this is an ongoing dialogue that we can have together relative to, you know, how do we proceed with this particular piece. The issue that we thought was as important, or if not more important, was the relationship that you have with your providers, your healthcare providers, relative to sort of medical monitoring or keeping an eye on you relative to any chronic conditions or conditions that may present itself through blood testing. So that was sort of where we decided to move. That was the direction we decided to move in. Not to say we would continue to have conversations with you about how do we do this.
Additional questions regarding new chemicals that are potentially there that are not being disclosed right now?
Yeah, this is an ongoing question, and it is a tough question to sort of give a great answer to. What we have been doing is we know the next generation chemical that replaces PFOA. We actually very early on hired one of the labs to come up with a test for it. There was no test out there. It's called GenX. There's another one called Dimona, but those are the next generation chemicals. This plant uses GenX. We hired ALS. They did go out. They developed the test. We started testing water samples for GenX, and we did not see any in the environment. One of the design concepts in this new chemical is it is supposed to break in the environment. And so at first we were very hopeful that that's what we were seeing. Then we kept not seeing it, and that actually became a concern that maybe the new test wasn't effective. Other commercial labs have developed tests for GenX, and we have hired them to also do it. We now use 3 different labs for GenX tests, and we have still not seen it in the environment. So we are hopeful that it is operating as claimed and as designed. We also have been given access to the EPA's lab, ORD, Office of Research and Development, which has highly advanced capabilities, something no commercial lab can do. Basically, they can go out and find whatever's there and then reverse engineer and figure out what it is. With other labs, we have to tell them what chemical to look for. We have taken samples and sent them off to ORD, water, soil, and also the soot from the inside of the stack to see what they are seeing out in the environment. And we're hoping to get those results back soon. As of yet, they have not told us that they have seen GenX, so we're looking to see what comes out next. We have also, in all of our tests, worked with the labs to get the broadest array of analytes. Those are the chemicals we tell them to look for, of anyone out there. We're now testing for, I think, 33 and 36? 27, sorry. Oh, no, they came with some new offers we're working on. So we have 3 different state contracts. Each of the labs has a slightly different analyte list. We basically asked them to go for the broadest array of analytes that they can look for. So we have C4s, C5s, C6s, C8s, a C12, and I think a C9 are on the list. So we are looking for the broadest array possible out there. I don't know what else might be on the lists. I know there's conversations that go online. There are huge numbers of chemicals used in industry, and we don't know what all of them are. But with ORD, we have the advantage. They're going to go out and find whatever is out there and provide us the names afterwards.
What are the highest numbers reported among the MVD customers? And do we know how long they were on MVD or where they lived? This was part of your presentation. Do we know of the MVD customers what the highest numbers were reported, and of those high numbers, how long they were on MVD water and how close to Saint-Gobain they lived?
Yeah, so some of that was in the presentation, and I'd specifically point you, when these are posted, I'd point you to the bar chart that was looking at the number of individuals that tested by certain PFOA blood level. And so again, the majority of individuals, 95% of the people we tested were below about 10 micrograms per liter. We didn't see a lot of really high numbers as we have in other populations that we've tested. For example, those with private wells whose some of their wells have tested in the hundreds of parts per trillion, right? So because this was a relatively, I think, uniform water distribution, right? There weren't individual wells with really high levels, that the blood levels end up being relatively compressed. And I'm sorry, what was the other?
That was...
So in terms of location, you know, we did look at PFOA blood levels by location, but obviously we can't, you know, publish the individual with the highest level and talk about where they resided, because that would be a potential break in confidentiality of who that person is.
There's one here, actually there's a couple that said, can you predict the results for those people that have spent a long period of time in that area within the 1.5 miles, living extensively or long periods of time in that?
Yeah, so this is something that we have to investigate further, is what does it mean that individuals that live closer to the Saint-Gobain facility and closer to MVD wells 4 and 5, what their levels are. The numbers of individuals within that area are still relatively small, and this was a point I wanted to make. But the purpose, just taking a step back, the purpose of doing a community exposure assessment like this and doing a random sampling, the purpose of doing that is so that it can be generalizable to other people within the community who have been exposed through the water system. So, you know, we can't predict an individual's exact blood level, but the purpose of the community exposure assessment is supposed to be able to estimate what somebody's blood level may be if they, you know, lived in a certain area for a certain length of time.
What's the responsibility of the town and or Saint-Gobain and or the MVD towards the people who are already affected with any illnesses?
I don't know if someone from the town would like to speak on behalf of the town.
Thanks.
I'll try. I'm Nancy Harrington, chair of the... I'll turn around. I think at this point, we've been waiting for the qualitative data.
Yep.
Obviously, we made that request for the blood study how long ago? And we've been waiting for the results, so we're happy to get them. Now, it's our responsibility at this point to be able to take this data, which we've been waiting for, and discuss what options we have, legal and otherwise. Because we've been able to make no judgments or opinions until now, and now we can. And the same thing with MVD. We're all in the same boat, so hopefully that addresses that question.
How long do PFOAs stay in the system, in an individual system?
Yeah, so there have been studies that have looked at what we call the half-life, excuse me, the half-life of this chemical in people's body. The half-life is the time it takes for the level to go down by half. And so with PFOA, it's on the order of 3.5 to 4 years that it takes the chemical to go down by half. Some of the other PFC compounds that we have been investigating in other areas of the state, like PFOS and PFHXS, it can take on the order of 5, 7, 8 years. So this is part of the concern around these chemicals, is that not only do they accumulate in the environment and contaminate water, for example, but when we consume them, they can also accumulate in our bodies and stick around for a lengthy period of time. Once exposure is removed, it's expected that levels in someone's body will decrease over time.
Do we have any idea how the employees of Saint-Gobain, either former or current employees, are affected?
We don't know. That's not. We have not gone to employees of Saint-Gobain specifically to study their blood levels or health effects.
I think the concern maybe behind the question is the bar graph that's shown in the overall national exposure. The people who were with the 3M plant in Decatur, Alabama, they manufactured PFOA. That's what they made. That was their product. In the case of Saint-Gobain, PFOA was a very small constituent of one chemical that they used in their process. So the exposure should be lower. However, it was in the water, it was in the air, you are exposed. So certainly if you were a worker at the plant, you're a part of the population. You're not necessarily separated out.
There's a question regarding the absorption from air versus water, and what's the difference there? And also the shorter chain PFCs?
So the shorter chain PFCs, I think that's what Clark was referring to, are supposed to be, I hesitate to use the word better, but are preferred maybe because the thought is that they break down and don't spend as long of a time in someone's body. In terms of the exposure question, again, there's have been a number of studies that have looked at and modeled how people are exposed to these chemicals. And the main way that people are exposed is by ingesting them, either drinking contaminated water, eating food that has had PFCs rub off from the packaging it was in, people that in their homes every day consume dust, ingest dust that may be contaminated, kids and toddlers that are putting toys in their mouth that may have been contaminated with these chemicals. So the main burden of exposure is going to be through oral ingestion. Now, we do know that these chemicals can also be absorbed through the lungs. So if people breathe in fumes, for example, from a chemical plant that's, workers that are, working around these chemicals, there can be fumes or vapors that people breathe in and can absorb through their lungs. But for the general population, the main route of exposure is going to be through oral ingestion. The difference in blood levels based on location and distance from the plant is of interest to try and figure out why the levels are higher around that plant and whether, air emissions, for example, could be contributing to that. We don't know at this point.
There was some confusion over one of your slides where it said that PFOA could cause an increase in liver enzymes. Mm-hmm. And another one later that said there was no probable cause to liver disease. Is there a contradiction there?
I'm sorry, can you say that again?
I'll let you read the question. I believe it was the slide where you had two columns, one where there was no relevance and the other one that there was probable cause.
So I don't remember specifically having anything about liver disease. I've talked in past community presentations about the difference between biomarkers and disease. And so there have been studies which have found associations between PFOA exposure and changes in liver enzymes, right? Liver enzymes is a medical test. You can go to your doctor can draw your blood and check your liver enzyme tests. Thank you. But that does not necessarily correlate with disease. So liver disease, we think of people developing cirrhosis or liver failure or fatty liver as an example. There have not been connections between PFOA exposure and liver disease. And so this is part of the difficult time that we have interpreting the scientific literature. So there is science that points to some studies that have found a connection between PFOA exposure and increases in liver enzymes. What does that mean for your health is not clear because there have not been studies that have showed a connection between PFOA exposure and actual liver disease, what a doctor would diagnose in the clinic. That's actually a very, very astute question, and one that whoever asked that, I'm impressed picked up on it because I didn't even realize what I was showing. So,
And this is like the 10th public meeting we've had with some of these slides.
Why are we only discovering this now?
I think this one's me. So it's two parts. One would be on the air side. PFOA has been regulated and has an air ambient limit for a long time, back into the 90s. Saint-Gobain did exceed it. They had a violation in around 2005, 2006. And so there was aerial exposure back at that time. And if you look at the average residents in this test, 10 years ago. So people who were here 10, 12 years ago, there was an aerial exposure. They were written up. They committed to a program of bringing their emissions way down. They have done that. We have done stack testing last year. We did repeat stack testing. As I said, we actually just sent the char, the residue from inside their stacks, to this ORD lab for the most modern testing in the world. They brought their levels way, way down. So on the air side, it was regulated. They did have a violation. They were monitored. They brought it down. And on the air side, they did what they were supposed to do. On the water side, when you go back to that time, we could not test to the levels that we're worried about now. About 4 or 5 years ago, this was put into a program called the UCMR-3, Unregulated Contaminant Monitoring Regime. Rule 3, third set of these chemicals that we were asked to go out and test. And basically, public water systems that serviced over 10,000 people had to go test for these chemicals. And MVD tested, and it came back at a relatively low level. However, it got retested and came back as non-detect. But at that point, non-detect was 20 parts per trillion. So it could have been sitting in 19 parts per trillion. We got one reading at 22 and one that was non-detect, and we said, okay, well, let's keep monitoring it, but this looks like we're okay. At the time, all we had was a provisional health advisory that said you wanted that number to be below 400. And we were pressing on EPA that if this is an emerging contaminant, you got to give us better guidance than a provisional health advisory. Testing has become far, far more capable and becomes more capable every day. Like I said, we're now up to almost 30 perfluorinated compounds that we test for every water sample we send out. Back then, they had to invent the test to go after the 6. The 6 that are on the 537. We don't use the 537 test. It's not as accurate as the modern test, and you can't do the analytes, so I don't keep up on the 537 test. But it was for 6 contaminants, that's all. At that point, their sensitivity was around 20 parts per trillion. And it's been steadily brought down to now where we regularly test down to 1, 2, 3 parts per trillion for different analytes. So some of it is back, if we'd have tested when they had the air ambient limit failure, we wouldn't have detected anything because the sensitivity was way up at that point. They invented the 537 test for the UCMR. At that point, it tested way below any standard we were told to worry about, and the second time we tested was non-detect. Now we can test to much lower levels. We have a health advisory and a state standard, and we're obviously finding detections above that state standard. And as was mentioned in other towns, we're finding it in the hundreds. So it is a matter of the technology has caught up and the knowledge of the importance of this chemical has caught up. And it's not that we weren't looking, it's just that we were blinded somewhat by the lack of technology back then.
And I have one last question directed to the FBD, so if someone's prepared. Are you planning a town-wide filtration for toxins? And if yes, will you pursue funding from Saint-Gobain to offset the cost?
Up to you.
At this time, we do not plan on treating any other wells other than the wells 4 and 5 that are offline. As Clark had mentioned before, there is an active investigation still going on at wells 7 and 8, so at some point possibly, but no plans at the immediate future.
All right, those are the questions that I had written down. I'm going to go down to the list of people who had signed in. I know some of you may have had your questions or concerns already addressed. If so, just let me know you're good with it. We're going to revert to typical town meeting rules. You're going to have 3 minutes. If you can't finish or you have additional questions you want, let me know. I'll put you back onto the bottom of the list just so that we get as many people as possible an opportunity to speak. I'm going to start with Wendy Thomas, followed by Rachel Ricker.
Hi there. I'm Wendy Thomas. I've lived at 10 Wellcat Falls in Merrimack for about 25 years. I live approximately 5 miles southwest of St. Gobain. We have a well, and a few weeks ago we had it tested, and I have the results right here. Our total PFCs came in at 20.4 nanograms per liter. 9 different types of PFOA chemicals were detected. The results are consistent with what is being detected from St. Gobain, and this level is higher than the MVD 2017 average of 16. The upper limit for PFCs is 70, so 20.4 doesn't sound too bad, right? However, if I lived in New Jersey or New York, where they are considering dropping the total value well below 20, my family's drinking water would be in the danger zone. I would be told not to drink our water. If I lived in Vermont, where the upper limit is 20, I'd also be in the danger zone. I'd be told not to drink our water. But I live in New Hampshire, where the upper limit remains at 70, so I'm told to drink our water. I have 6 kids, several with very severe health issues. I have a son on an immunosuppressant. Can the town or state assure me that a value of 20.4 is a safe level for someone with a compromised immune system? Again, I live 5 miles from St. Gobain. There should be little to no PFCs in our water. This is a specific chemical that has been spilled into the water by a Merrimack company that has a history of doing this before. We are going to have to put in a filtration system, an expensive but necessary precaution because St. Gobain has contaminated our family's drinking water. Someday I'd like to retire and sell my house. Would you buy a house with well water that measures 20.4?
Thank you. Rachel Ricker?
I think she's looking for a response.
Oh, okay, go ahead.
So, not to argue with you, and I'm sorry that your children have health conditions. You're somewhat confusing PFCs, which is a family of chemicals, with any one individual chemical. We have a state standard for PFOA and PFOS that when combined together should not exceed 70. New Jersey, for a single chemical, has proposed a standard of 14, but it has not been made law. In the case of Vermont, they've gone with single chemicals at 20 parts per trillion. So taking the broad array, and as I said, we now test for almost 30 of these, and if 30 of them came back at 2, we'd be at 60 if you just add them all together. That's not how the health advisories work. And the best science we have, and I realize everybody would love to have better science. I would certainly love to have better science. The best science we have today says the combination of PFOA, PFOS, 70 is protective through life for all health conditions. Now, if you are immunosuppressed or have unique health conditions, that's not what the science was conducted on. And I don't have science for that unique condition, and I wish I did. I've said this, I've had a number of office hours here and private meetings. We put uncertainty factors on these standards because we don't have great science that says here's exactly the number. And what that does, it takes the number and makes it really quite small compared to what the science would say is safe, because we want to be protective, and we all do. The challenge with that is then trying to go out and explain, okay, we've been reasonably protective. We've taken the best science, we've taken the uncertainty, and we are being fully protective. But we do have environmental health assessors. This is what they do. And they go through the research and they come up with that assessment. And we do believe confidently that 70 parts per trillion for just those chemicals, not for the whole suite of 30, is protective through life. We are continuing to do research. In the case of New Jersey, they did something different than people had done before, and there was a lot of commentary. Usually, if you put out a peer review, you take one round of comments, and then you say, okay, well, thank you for the input, and we either publish or perish. In their case, they actually went out for another round because there were enough questions about the methodology. In the case of Minnesota, which has been brought up, where their standard is 35 for PFOA, and PFOS is a different number, and we got more PFOA problems, they actually went out and did primary science. They created a new model for how the chemical goes in and out of the human body, and we're reviewing that model. They've been very helpful in sharing information so we can try and understand, because it's a different way to go at it. But we are trying to understand that, and obviously if we could really pin down the science and say, okay, this is not protective enough, then we would work with our state legislators to try and get the authority to move to a new standard. But off the best science we have today that is peer-reviewed, that our health assessors have been able to go through, 70 parts per trillion for just those two chemicals is protective.
Okay, but remember I live 5 miles from St. Gobain, and you're only testing with a 1.5-mile radius. Perhaps you need to extend the area that you're testing.
We are. We're way outside. And the 1.5, I should also, everybody's taking it as like a magic line. The biggest area we had ever tested was a half a mile, so we started at a half mile. And then we followed the data out, and we said, okay, well, half a mile wasn't good, let's go to a mile. And then we kept testing out, and it wasn't good enough, so we went to a mile and a half. And at that point, we said, okay, we're just going to follow the data. Stop putting radiuses out there. We are testing way beyond a mile and a half, way beyond 2 miles, way beyond 3 miles.
5 miles?
I would say the levels you're talking about, you can go anywhere in the state and find those levels, and they'll have nothing to do with St. Gobain. Please show us the results. If you could, Brandon, raise your hand.
I'll share the results, but if you could send me a reference or something for what you just said, if anybody tested their well water, they would find these levels in it.
Brandon can get you exact data.
Thank you.
Again, raise your hands so we can find you.
Rachel, followed by Wolfram.
Hello. I have a lot to say, but since we don't have a lot of time, I get 3 minutes, I'll jump right into my question. My name is Rachel Ricker, and I've lived in this great community for almost 8 years. I was one of the lucky families to be chosen, and I consider myself lucky, to be a part of the MVD Community Exposure Assessment. I have a beautiful, sweet 3-year-old daughter. And I am normally a calm, rational person, but I'm not going to apologize for my emotions tonight. For 2 PFCs, which are in our MVD public water supply, because I looked at the full results, not just for the 2 that are published to our community, but the full results, my daughter tested 30 times the geometric mean for 1, and almost 40 times the geometric mean for another. Can you please help me understand that and how I can help her?
Thank you.
Yes, and I'm sorry. I know this is probably understandably very concerning. Can I ask what the two PFCs were?
Yes. PFDOA and PFDEA.
You said DOA and DEA? Okay. So those are not PFCs that we have found in very high levels in other, communities. I'm happy to look at your test results. I don't know if you have them. I don't want you to feel
No,
like
I
you
have
to
them.
share
I'll be happy
here.
to share them. And my best case scenario for tonight is I would just love to get her retested. I'm like praying it's a mistake.
Yeah.
I'll even pay for it if you help me write out the paper to bring to the lab. It's just appalling. 40 times. And I don't understand why we're not sharing all the PFCs and adding them up. Why are we picking 2? There's 23 at least that are being tested for or something that I have the results that are in our water. There's more than 70 parts per trillion in our water. It just hits home when your 3-year-old daughter has such high levels.
Yeah. So I'd like to understand what kind of levels you're seeing. This is the unfortunate situation where for many of the PFCs, like the ones you mentioned, there is not a lot of information or science about what that means for your child's health. And I completely understand that finding any PFCs, certainly ones that are even less well known, is absolutely, not knowing what that means is understandably concerning. What I would suggest is, I don't know if you've made your pediatrician aware of the results.
I just got them Saturday.
Oh, okay, all right. We have been working and will continue to work very hard to try and inform and make sure that healthcare providers, pediatricians especially, have information about what these chemicals in general are and what they potentially mean for someone's health, so that your pediatrician can monitor your child's health. That's not an immediate answer, but I would like to understand better what kind of levels you're seeing. And unfortunately, most of the science around PFCs and health outcomes is in the more commonly detected ones like PFOA and PFOS, PFHXS, PFNA, and so the ones that you mentioned are not ones that are as familiar to me, and partly because there's not as much information or data about it. I think in the absence of data and information about specific PFCs like PFDOA or PFDEA, I think you mentioned, oftentimes we'll look to see what other findings have been seen in other PFCs, and and look to healthcare providers to say you may want to follow your patient for these health outcomes that have been seen with the other PFCs.
I guess that's the best answer you can give me, but it still doesn't make me feel any better. But I appreciate you taking a look at the results after.
I'm happy to. I'm sorry.
And helping me get another blood test that I will pay for.
And I'm sorry.
And helping me write another prescription for a blood test that I will pay for. Because my doctors don't know what to run for the panel.
A blood test for?
I want to get it retested.
She wants to get it retested.
Oh, you want it retested?
And I'll pay for it.
So
okay, we can.
Yeah, why don't you talk offline?
Let's talk after.
Okay.
I will try and answer one of your other questions, which is, again, a really good question. It's one of the hard things in this whole emerging contaminant area, and I'm sorry for the stress associated with these. Unfortunately, these are not two that I'm familiar with. We've made a conscious choice, and we hope you agree with it. We could continue to stick with the 537 list of the 6 most known contaminants and just keep testing only for those. And certain states and certain industries and certain groups have made that choice. We went the opposite. We want to know what's out there, even though unfortunately it has us sitting in front of you. I'm literally copying these down because it's the first time I've heard those two. I would also suggest check the testing for P's group.
Yeah. Well, I just checked the MVD. I got it from some office, and I see them all. You see, I can give you the spreadsheet. You see all the PFCs that are in our water. So I'll be happy to share them with you, but they should be public for everyone to see.
And all of our results are public. You can
I know, it's
go one
DES,
step.
I agree, DES. I'm talking about why aren't the ones from the
Well,
MVD?
the blood results, I don't see your blood results.
No, I'm talking about the PFCs that are tested in our well water.
We
Or
do
NVD.
share those.
I only see 2 published, PFOA and PFOS.
Well,
I'll give you them all, and please post them because
say
everyone needs to see how many are in our water.
yeah, the regular updates where we try and keep a time record, we can't do 60 across. We actually
I
tried.
printed them out in
We
10
do
pages.
through One Stop. They're all available. You can go in and get every single test, and each individual test will show all of the chemicals. But to try and show some time series, we try.
Maybe we can post it on the town website. Okay?
Yeah, we'll
Okay.
try and figure that out.
Okay.
But I will say we made the choice, and it does put us all in the tough position. We know more about the chemicals that are in our water and in our environment, and the more of those chemicals we know about, unfortunately, the more of them we're going to know less about.
Understood.
And it was on the team and my choice. We thought that was the right path to go down.
I agree.
Thank you, Rachel.
Thank you.
Wolfram? Followed by Catherine Hodge.
Good evening. My name is Wolf, and I had the pleasure of talking both to some members of the council and DS in some of the meetings here lately in the office hours, and of course the Merrimack citizens here for the water situation. I'm new to the town. I only moved here 3 years ago, only got aware of this issue maybe 3 or 4 months ago, decided to get involved because I have kids. Obviously, that's a motivation. And one thing that I mentioned to the council was that as a newcomer to this, I see a lot of interpretation of signals, accidental signals, real signals on both sides. And one thing that I really would lobby for here tonight is to find a committee, a group, and it may just be the town council meeting like has been suggested tonight by Bill, but it may or may not. Might be something that the DES or the NHDES also might be wanting to participate in, but just something that increases the frequency of direct, verbal, face-to-face communication to avoid signals where something is posted on the website about tonight, how deep buried in the website, how high and how present, nixel communication and so on. Was decided very late in the game to do that, maybe because of the pressure, maybe not because of the pressure of the citizens of Merrimack, but we can eliminate a lot of this interpretation of signals by talking face-to-face much more frequently. Not through social media, not through websites, face-to-face. And I do like to ask that question tonight. Everybody's here. Anybody want to commit to that, and what gremium, what form of organization do we want to choose for that? Thank you.
I'll say from the standpoint of DES, we're very happy to participate in any group. We've been called to the town chambers. We've done 3 of these open meetings at night. I've done office hours. There was a coalition that was being formed between the towns. We came to multiple meetings of that. Basically, if you're holding a meeting and you want us to come, we'll try and support that. Please be aware we have over 30 investigation sites around the state. I don't mean this is a bad thing, but nobody wants to combine. As I said, there was a goal to try and get a coalition of the towns for St. Gobain together, and that couldn't work. People in Merrimack want a meeting in Merrimack, people in Bedford want a meeting in Bedford, people in Manchester want a meeting in Manchester, people in Litchfield want a meeting. We only have so many staff, we have 30 investigation sites, and if every town wants a separate meeting for just their town on a regular basis, do the math. If you can help us by combining and having one regional meeting that everybody comes to, and I will say I noticed, he's hiding now, the town manager from Bedford's here, and I know some folks from Bedford are here. In my office hours, I have folks from Bedford and Amherst. So I see some of this happening, but it really would help us. If it's a Manchester meeting or a Merrimack meeting, then just multiply it by 30, and that's what you're asking us for. We're very happy if you have a group and you want us to come and have a discussion. I think we've proven, and hopefully we keep proving, that we're glad to do that. But it is sort of a challenge with 30 active investigation sites to do the investigations and separately communicate with every town individually, because those 30 sites are not 30 towns. They're 30 sites, most of which cross 2 or 3 towns.
I think we all appreciate that, and I think you're going to find the Merrimack Citizens Group to be flexible and open to a forum, but you're putting, no offense, and I really appreciate you personally, what you've said repeatedly in front of me and others, but you're putting the onus on citizens again. We have authorities here that communicate anyway. They have means of communication. They have defined missions, for various aspects. You're asking, in my opinion, to put, the cart before the horse. It would be great if authorities, and honestly, I don't know who that is. Is it the town council? Is it an individual in the town council? Is it the NHHS? I really don't know. Is it the state? It would be a lot easier for that draw, for that pull with the marketing tools and communication tools you guys have to pull all the different fractions that need to work together on this and find a resolution, to pull that with you instead of the citizens pulling you, into an agreement that doesn't exist right now.
Well, that's what we try to do with these town meetings, and we've had 10 so far between the towns associated with this one plant. This is a third here in this gym. Third in this gym.
Right, but again, we're talking about frequency here. We're talking about not making this, a year and a half leaves so much room for interpretation, and this doesn't help you personally, any of you, the town council. People have been under attack and scrutiny for no reason, maybe even. You know, I mean, there's judgments being made, maybe ungranted on either side. We can eliminate that by increasing the frequency to a select few possibly. It doesn't need to be 150 people either by any means. It should be a small select few, 5, 6, 7, 8, 9, 10. But do it every 6 weeks, 8 weeks, 4 weeks, 3 months.
Thank you, Wolf.
Wolfram, I know that the Merrimack Concerned Citizens asked for better communications with the council, and we had one member, Bill Boyd, as a liaison. But am I getting you right now is that you want to see, and I heard a number of members of the group that reached out, and you want to see kind of a group, maybe a representative not only from the town council and from your group, but MVD and maybe one state legislator. And I understand where Clark and Dr. Chan are coming from, that they may not be able to be on that particular board, but I wouldn't have a problem, and I know other members of the council wouldn't have a problem with us having a council member on a group such as that. So you can count on somebody from the council, and I guess it's reaching out to the other folks involved in this whole process.
When do we kick it off?
Excuse me?
When do we kick it off? How do we kick it off?
Well, I'll be happy to talk to you right afterwards, and then maybe we can get the other stakeholders or whatever.
Okay, thank you. Yep.
Catherine Hodge, followed by Lorene Allen.
Nice to see you guys again, but I'm not going to address you. My question is going to be for town council, but first, Bill, we would like to thank you for the motion that you made to seek counsel about the rights to ask for more for Merrimack, as other communities have already in regards to the water contamination at the last town council meeting. We greatly appreciate that. Now to include the entire town council that's here, I would, as our entire community, would like to know where our town council is in regards to the process of getting us more than we already have, and how are you going to fight for the people who have elected you to be on the town council?
I'm being designated. As I mentioned earlier, we've been waiting for this. We've been involved, I've personally been involved for 3 years in this. Going to MVD meetings, you didn't like seeing me there, but I was there a lot in the beginning. A lot of meetings with DES when you came and did the presentations. And what we were waiting for as a council is the results of the blood test we've requested. Because that was going to give us data to be able to say, this isn't Bennington, Vermont, this is not New York, this is Merrimack. Now we've got stuff from Merrimack. Now we can get into deliberation, like I said earlier, about what are our options. And let's not forget MVD. You need to understand the town council has no authority over water. A lot of people forget that. Well, that's a whole different issue. But we have no control, authority over anything to do with the water department. I'm sorry. Yeah, now that's a different issue. Okay, let me segue into something else about the air. In fact, in answer, I asked a question. We had written a letter, because we were concerned about the C6 as well. And in a letter, the town council voted, 6 weeks ago, whatever it was, asking DES cannot evaluate air emissions. Is that accurate? Mm-hmm. They do not have the authority. They can test water. So we have to wait for the air emissions to get into the soil to go down to the water. There is legislature that was proposed to give them the authority to do air emission analysis. Complications happened, things happened, it wasn't done. As a result, the town council, whatever it was, 6 weeks ago, decided to, okay, let's shoot for this again. We want to be able to get the stacks or the air analyzed. But we need to be able to get DES the authority to do it. So we wrote a letter to all of our legislators and it's in public record, which they're nodding, asking them to work diligently to get that legislation done so that DES has the authority to do the testing. Because we shouldn't have to wait till it gets in the water. We should have to do the testing in the air.
Why has Bedford managed to get all the things done?
Well, that's a good question I asked the other day.
In 2016, Bedford has managed to get a lot of things accomplished without the data that
No, that's all right.
that the town council of Merrimack has chosen to wait on. So we actually could have had more going on for the last year and a half. And not
Okay, specifically, what do you mean? Help me understand. What are the details? Because that's the stuff we need to address.
DES and Dr. Benjamin Chang, June 2016, Bedford Town. A lot of the slides Dr. Chang showed, I saw today from the Bedford meeting, June 2016.
Yeah.
Why are we so slow? St. Gobain is Merrimack, we're Merrimack, how come Bedford's getting everything?
But what are they getting? That's what I'm asking.
Pardon?
What are they getting?
They were talking with St. Gobain, it's all listed there. You go to the DHHS.
Okay. I don't know the answer. All I can say is MVD. I know, because we have been haunting MVD for quite a while, and about getting together with St. Cobain to get a resolution done about the filtration of 4 and 5. If we can get 4 and 5 filtrated, that's going to dilute the overall even more. We can't answer that. We're not privy. I can only answer one thing at a time. We're not privy to the negotiations. One, we have no authority. We have no authority.
Well, that needs to change.
Then that's a whole separate issue. That's a whole separate issue.
All right.
If I could,
Go ahead, Clark.
because I see Rick Sawyer sitting in the back as the town manager for Bedford. How many homes in Bedford have been connected to public water? 0. And in Merrimack, we've got 16 done, 2 getting done this week. So actually, there's been more progress in Merrimack than there has in Bedford.
Ladies and gentlemen, we're going to keep this civil and keep it in control, please. Thank you.
What has been agreed in Bedford is to complete a design for a possible extension. Unfortunately, in the history of how this thing happened, actually, this is the place we had the first meeting with anybody. It was right in this gym. Merrimack was the first discovery and is the first place that we began work, and it's the first place that St. Gobain started spending money. Litchfield was second. They have far more wells than this town does, and there's been more progress in Litchfield because it's wells and there's public water available. My hope is we will be back to you soon with treatment on 4 and 5 agreed, and the neighborhoods that were identified that are on wells, which are a little further out, that they are going to get extended public water soon. Right now, everybody in Merrimack who's been in a neighborhood who's identified as being over the state standard is offered bottled water, and if they're over 70, they've had point of use installed also. So I would not say that there's not been progress. I think we're all frustrated because it takes longer. I would say, compared to other states, Vermont started this whole process sooner than we did. They'll have a design for the first home to go on public water next summer, a design. We have over 350 homes in this state that have been put on public water at St. Gobain's expense. So it may not be terribly visible because your home is not done yet and you are inconvenienced, and I understand that, and we're working to try and get that fixed. But as a state, we actually have made pretty good progress in dealing with this issue. Town by town, yes, one town could do better, one town could do worse, but we're trying to move on all fronts to get as many people on public water as quickly as we possibly can, and to get the public water treated in this area so that the wells can be brought back online.
Rachel, we're going to move on to some other people, give them an opportunity to speak as well. I'm sorry. Catherine, I'm sorry, yes. Lorene, are you still here? Bill, do you want to chime in briefly?
Very quickly, if I could, Madam Moderator. Bill Boyd, Town Council, to Commissioner Frizey. The Town Council sent a letter to Department of Environmental Services asking them to intercede and outreach to St. Gobain, seeing if they would be willing to voluntarily submit to air emissions testing on the smokestack. maybe I'm putting the cart before the horse, but I'm wondering if a conversation has occurred and if you had any status or update regarding the request that the council made to DES as it relates to voluntary testing by Saint-Gobain. Thank you.
Yeah, as I said before, what we actually did is sort of jumped ahead and we took samples of soot with Saint-Gobain's agreement from the stacks. And that's actually a concentration of what comes out as the air emissions. ORD is set up to test that immediately. So we have the most advanced testing in the world going against what's coming out of their stack right now. We are writing up the process that would be necessary to get an actual air sample to have the air sample go into that same testing. What we found so far is the soot that's in the stacks is a higher concentration than what was in the air when we did the previous testing. So if it's going to show up, it should show up in the soot. The one concern is, well, not a concern, so far it seems to be working well. Gen X does appear through process and release to the environment to break down because we're not finding it in the tests. So if Gen X is breaking down through their process, it won't show up in the soot or in the air emissions. But the soot does have the highest concentrations from our previous testing. We did do air testing. We did it with our commercial labs where they can only test for what we asked them to go test. We are setting up a statement of work and requesting it from Saint-Gobain for the advanced support to go to this advanced testing. We're having to be careful in how we write it up because it's new. ORD hasn't done air testing before. Their lab is really trying to help us go after this question as hard as we can. And I actually met with the woman who runs the lab, and she really gets it. She thinks we run a very professional show. We've been very supportive in their efforts of getting additional chemical signatures that help them in doing this work, and then they could take that work into the rest of the country.
All right, Lorraine, still here? Okay. Followed by Troy.
Oh my goodness, where to begin? Thank you all for coming here tonight. It's just the beginning of this all. So over the last year in particular, I have spoken to the CDC, the EPA, Philip Grandjean at Harvard University, Phil Brown at Northeastern, countless people. Also ATSDR this last week extensively, had an extensive talk, engineers from out of state, Dr. Knapp, a PhD in Delaware, that if people haven't spoken to him, you should. He is the gentleman responsible for the Gen X testing in the Delaware River. Dave Hassels in Vermont, who is an engineer who is responsible, believe it or not, reached out to me, visible that I am. He designed the stacks for ChemFab back in the day before they, you know, whatever they were doing, whatever they were not knowing, and what they were going to use for. He has a slew of information that, if you were willing, I'd love you to talk with him. He's a wealth of information, very factual about models and design. He's a brilliant engineer. So that being said, there's a lot of things going on here. One is, as you're talking about, you're testing the public water for a good panel of analysts. I've seen private well results from many, many people in town. I've seen the public water results, of course. I've seen blood tests for many, many individuals. So what I see over and over and over is I have an idea of what's showing up in the water and what is lower and what the geometric means are of the other chemicals. I do understand the research does not show the effects. So I'm rather intrigued by, we're doing a great job in DES. You're spending tons of money, I'm sure, in testing. So we have all this data and it's great. But here we are in the community, as people know, that we had residents reaching out to other residents this summer with a health survey. Not a health study, a health survey. It's only a sampling. But what we did find is within that 1.5 mile that you were looking at, and in neighborhoods where private wells tested higher, we had public water customers reporting multiple illnesses associated, not caused, with PF, the whole category. It's not just PFOA. So my concern as a resident since 1985 is multiple. You know, you're going to time me out before I'm done, I'm sure, but I'll take my full 3 minutes, thank you. And what I'm finding from ATSDR, they're the folks, for those of us who don't know, that they would be the ones helping us with a health study and helping our community get these answers. DHHS reached out to them last summer for what's called a health consultation. So what they do in that process is, I'm looking at you guys and you know this, it's so funny, I feel like I should be looking that way, but so they do a draft in their process, number one. What I found out last week is that draft hasn't been returned back to them. You asked for that maybe July, August of last year. That's not your fault. You did that. So Tara Summers in Boston was lovely. She was uncomfortable at times, but stopped. And I kind of filled in the blanks, and she didn't confirm or deny. But what we did is we walked through the process. After the draft is approved, they do community input, and public will be asked to speak. And you know this. I watched this process in the Seacoast and Peace. So I watched them go right down to the 11th hour, as you all did also. Feasibility study is next, then study design, then the IRB, and then boom, they launch it. Oops, that's where it all broke down in Peace, isn't it? It was about appropriations. Department of Defense told them, oh, hey, you know what? We're not going to be able to do that after all. They spent a year and a half, I don't know how long, the CABs, the CAPs, all the acronyms I've learned this year. I'll wrap it up.
Thank you.
It's really important. So what I heard from Tara Summers at the ATSDR is all the data we have, the 23 analysts plus that I've seen in the public water results, PFNA and PFHXS have similar qualities to PFOA. We know they've been there, and there is some research on that. You know, there's research on the shorter chain. I've seen it. What we're finding on our government sites is not going to tell the whole story. We know this. So appropriations are the issue, people, not just here in town and with you with, you know, blood testing, you know, with talking about $5 million or whatever that ungodly amount was. The issue with ATSDR, who we turn to help us on a federal level, is appropriations. They told me, cutting to the chase, they are not allowed to advocate for their own appropriations and increased appropriations. They've been sued recently by a national coalition that I'm part of to, quote, do their job. They can't do their job. They don't have appropriations. So it really is up to us, folks. You know, we are the data. I never wanted to be in a case study. I'll wrap it up. Dr. Chan, you said that as you talked about the half-life of some of these chemicals, I'm pretty familiar with all of them at this point. You stated something that was really key here that I don't know if people heard, and it's the 3.8 alone in PFOA is assuming, you know, no further exposure. We still have exposure. We still have exposure. So, you know, we have things that are kind of stuck on our systems, and it's up to us on our dime to filter our houses, and I'm worried about filling up the landfill with more plastic and more filters, and it's a mess. It's a mess.
Thank you. Troy?
Well, I was just going to say thank you for your comments, because I absolutely understand and agree with much of what you said in terms of what you're seeing in the community and the concerns that you expressed, and the process as well that's gone out on the Peace Trade Port has been a really long and drawn out process. And you know, I want you to feel somewhat reassured that, you know, we are, the Department of Health, the Department of Environmental Services are trying to push for exactly what you are talking about: appropriations, resources, money. And I know that we have individuals in our congressional delegation, Senator Shaheen, who has gone to bat and has tried to get funds to do this type of work and the type of study that we're talking about. And so our hope is that this kind of work will be much quicker in coming than it has in the past as this national issue grows and attention comes to it.
I don't know. Okay. So I think I had mentioned to some of you when we met one-on-one that we had signed on to a letter to ATSDR, CDC, and I actually did get a responded letter back. So this letter is from Brenda Fitzgerald, who's the director of CDC and the administrator of ATSDR. So dear Ms. Morris, thank you for your concern about PFAS in drinking water. I agree there are gaps in our knowledge related to this issue. CDC and ATSDR is consulting with state health departments to identify candidate communities and trying to determine the most appropriate and effective design for a possible study along the lines you suggested. This could enable us to move forward should resources allow. There's the thing. I appreciate the offer you and your colleagues have made to share information about communities that are or were exposed to PFAS in drinking water. I also commend your continuing efforts to work with communities to minimize their exposure. So, as you know, I value your feedback in the partnership between CDC and state and local health officials, and then they name The director of ATSDR is as the lead. I'm not sure exactly what this letter means, but at least it's a response. So.
And so for those who weren't aware, New Hampshire signed on to a multi-state letter that was sent to the new, I believe, director of the CDC, pushing for more funding and more resources to do a national health study around what PFC exposure means for someone's health. You know, there's been a lot of focus, especially out on the seacoast on the Peace Trade Port, about studying communities that were exposed through Department of Defense or Air Force contamination. But we have certainly gone to ATSDR and have gone to the CDC to push that any national health study not just be done on Department of Defense facilities, but also in communities like yours here.
Troy? Is Troy still here? Troy Trudell? No, all right, we'll go on to Kathy Stack, followed by Kristen Ayers.
Okay, thank you very much. My name is Kathy Stack. I live on Knollwood Drive in Merrimack, and I've been a resident here for over 30 years. If you don't know, my property tested at 74. I'm on a private well. I'm in the designated contested area zone. Before I forget, I did want to thank Bill Boyd for doing what he said he would do. He kept his word. That goes a long way. I am puzzled with what is happening now. What are we doing moving forward for the people in situations like myself that have a private well that is tested way above the acceptable rate? Yes, I have bottled water. Thank you very much. Nonetheless, I have been exposed for over 30 years. The governor has said that I believe he's on record for saying that he wants a safe and clean drinking water. That's a priority for him. Yet we have 23 private wells in Merrimack that are over 70. 2 public water wells that are closed. I've got neighbors in my town across the street from me, that have private wells that are testing above the 70 with a slew of medical ailments: prostate cancer, a mastectomy, skin cancers, just to name a few. What are you doing to help us?
As we discussed at office hours, I think it was 2 weeks ago,
I'm glad you mentioned that because that's going to bother me too. Thank you very much. And I appreciate your comments. I appreciate being here. All of you, I appreciate it very much. However, I have been dealing with this for over a year now. Mm-hmm. I have gotten mixed messages from DES for over a year now. I respect you very much. All of you here have more information than I will ever have. I respect you, and I hear you saying that we're in negotiation, and it's gonna be soon, but I've heard that for a long time. So though I respect your saying it, I'm glad you brought it up again, that maybe it was 2 weeks ago, maybe it was a month ago, maybe it was 2 months ago.
I've only done office hours for the last 4 weeks, so it was in the last 4 weeks.
What are we doing? I've heard this.
As I said, unfortunately, we went over it, as a state, we have certain authorities, and we can absolutely, use those authorities, but only those authorities. And they have some scientific data that would indicate that your neighborhood is not due to their emissions. We now have enough testing data from enough wells in your neighborhood, and you showed me which neighborhood it is on that block, so I know which one, that we are absolutely convinced that it is their responsibility. As I said, I had a meeting with the AG and their lawyer where we went through and said, here's our data. You may have these models and it, XYZ, that's wonderful, but I now have enough data that I don't care what your model says. And we had that sit down. I do have to be careful when we're in negotiations. they do have certain rights to be protected in conversations they make in open negotiations. I am very hopeful that this is a month that we will have an announcement. Now, unfortunately, given the season, and it is eventually going to be fall and winter, we will not get done this year probably. You do have MVD water that's adjacent to your neighborhood, so there's some chance we might get some of the homes, but to really lay main through all of the neighborhoods in that area and get it all done, pressure treated and done properly, some homes will be on bottled water through the winter. As we talked about, I try not to sugarcoat things if there's no reason to, and we're not going to get everybody on public water this year. Same as even if we do get the agreement for MVD, should be careful. MVD negotiates with St. Cobain for MVD's needs as far as being damaged with a well. I try to be helpful and we try and engage in pressure where we can. Even if they got agreement tomorrow, those wells will not be online next summer. To get a proper treatment facility online, tested, you want to prototype first. There's a number of steps you want to do to make sure that the water that comes out is clean and safe. That takes time, and that will not be done next summer, even if they get moving tomorrow morning. Right now, I think we could have it on for the next summer so that that capacity is available. And I said those two wells are good wells. They have a lot of capacity. That would be an aggressive schedule.
Kristen?
Thank you, guys. I really do appreciate you being here. Dr. Chan, Clark, Lisa. I don't know who you are, but thank you for sitting up here.
That's Ron.
All of these open chairs speak volumes to me. It's quite sad, actually, that we have all these open spots. Officials who I don't even know, I wouldn't know them from anybody, actually, who should be sitting up there and answering to us and telling us what they're doing for us. So thank you for sitting there and being under the hot seat.
If I could, I've got a huge team here. We didn't want to just have everybody sit up here. We want to leave people out in the crowd.
I'm happy with you.
Okay, because I was going to say, I see Mike Fitzgerald is like jumping to get up here.
I know Jim Martin. I know you. I know quite a few of you. Our own town officials who I would have expected a little bit more since this broke are kind of, I don't know, but I would welcome, and like I said, it's just kind of a sad state of where we are as a community. So I thank you for being here. Let me get to my point. Regulation of this chemical class is at least a decade behind, and St. Cobain has spent over a year at this point actually, disputing responsibility for the old chemicals, the PFOA, and well, there's not much PFOS, but it's in there. Why do we think they will actually take the responsibility for the newer chemicals, such as Gen X, like you said they use, that preliminary research is showing causes harm to our bodies? You may think, Clark, that Gen X, it's wonderful because it's not showing up. PFOA has been used for how long?
Since 1951 in full industrial production.
And we're just seeing it now. So what are we going to find in 20 years from Gen X? Like Nancy said, we have to wait until it is in our soil. So right now, every day, my daughter, is running around in the soccer fields and playing around in Merrimack, is breathing that junk in. It may not be in the water yet, but it's in our bodies. So I'm concerned that we don't have a... So I guess my point is, how can we count on St. Cobain for being honest when they won't even tell you, DES, what chemicals they're using? They won't disclose it. Didn't you reach out to EPA to ask for help because you can't identify chemicals? Because they won't tell you that.
So, one, I'm with you. I would love to have far better regulation in place about chemicals that are in the industrial stream. I 100% agreement with you. And the state representatives know that we have a team meeting every Tuesday where we go over and coordinate what's going on throughout the state. And we sit there on and on looking at each other. What's the next chemical? What's that next one that we're not looking for? How do we go after it? I will say in the case of St. Cobain, yes, they have responsibilities. I would say compared to many companies, they've been pretty upstanding. When they clearly had responsibility in Litchfield, they wrote a check for $14 million.
So weren't we supposed to have, was it temporary filters in January, I think?
If I could finish my answer, then we can go on to the next question. They've spent millions and millions of dollars. They've got some areas where their engineers have said, it's not yours, it's somebody else, and they've fought that. They have shareholders, and for their shareholders, they ought to try and make a profit. I used to be in business, and you try and make profit for your shareholders. Where we've showed them, we've got data that disputes it, they're now in serious negotiations. From the standpoint of Gen X, part of their problem is they don't know what chemicals they're using because they're now buying proprietary blends from companies who make those blends. And they are labeled that they do not have PFOA. They are labeled that way. When we got access to ORD, they gave us access to every one of their chemicals so we could tell them what's in them. So they're not hiding behind it. They actually have been engaged because they would like to know. They'd like to know what the next chemical is, and then they would like to make sure it's not showing up in the environment. And like I said, just let me finish. We went to them and said, we have access to this lab. It's the world-leading lab. It's going to find anything that's in there. And they let us go swab the stacks. They let us go take samples. They gave us samples of every chemical that they're using. So, I mean, yeah, I'd love to poke at some people sometimes, and nights when I'm not sleeping because of this stuff, they're not the first company that I want to go buy stock in. But to say that they're hiding behind things and being irresponsible, they're actually engaging in the investigation. I would love them to just say yes to the things I've asked for and get it over with. Their lawyer's talking to the Attorney General.
I would love to know who they are because I know you said somebody's here, but they should be up there as well. They should.
To be fair,
flat out.
they're a company, they're corporate advisors.
They polluted
Kristen,
our water.
Kristen, let him finish, please.
Their corporate advisors advised them not to do it. They have multiple legal situations around the country and probably around the world, and they're being told not to do that. We told them they needed to get a better feel for what's going on in these meetings, and so for the last couple, they have sent somebody to take notes, get a personal impression, and provide the feedback beyond the feedback I give them, because I think I give pretty straightforward feedback. But it's different when an employee tells you about the discomfort and emotional trauma that people are feeling, as opposed to a state regulator who's negotiating with you telling you the same thing. But to have somebody who's just been asked to come and take notes, sit up here and answer questions that they don't know anything about is not fair.
I will disagree with you. We'll go on record that I disagree. Okay. I think that they should be up there. I think that the bar has been set low because apparently they look good as far as polluting and then the follow through. I don't feel that they are doing anything for us, but that's me. So there is someone here who asked me to read this. And the question is aren't members of the town council as concerned about our health? I think that we heard, and I appreciate that. But like I said, I think it would be good if you guys were more present. Just want to say that. So the question is, rice, pasta, etc., that absorb water to cook are also absorbing contaminants. Recipes including water for tea and coffee, water for sports, water used to rinse your fruits and vegetables, water used to water homegrown fruit and vegetables, water used to brush your teeth, water breathed in during showering. Children's bodies, we know, are more vulnerable to the chemicals. Can you please tell us that it's safe to brush our teeth and go swimming in a swimming pool with contaminated water?
Yeah. So we do suggest that any water that will end up going into your mouth, especially on purpose, that it should be below the state standard of 70 parts per trillion for combined, or if your water does not have that, you should be on bottled water and you should be using it. So brushing your teeth, cooking pasta, obviously drinking it, or making a dish, soup or something else, make sure it's a safe source of water, either below the state standards, or if you're above state standards, please get bottled water. As far as the washing the hands, swimming, the science we've seen, and Dr. Chan can talk to it more, It's not the passing through the skin, it's not the breathing through the lungs, it's the amount you drink, because you drink, on the low end, 2 liters of water every day, every single day. And that's where you really get the maximum amount of ingestion. And so that's why we really focus on drinking water in our testing, in our activities and everything.
We have Michelle Anderson.
I was just going to say that I agree with what Clark said, and it goes back to comments I think that we've made earlier about, again, you know, the main way that people are going to absorb this into their body is through ingesting it. And so, you know, referring back to the water standards that have been set.
Michelle Anderson, and then Diane Link.
Hi, Michelle Anderson has allowed me to ask a question in her place. My name is Nancy Murphy. I've lived less than 2 miles from St. Gobain for 31 years. I'm a parent of 6 children who, as some are adopted, are not biologically related. 2 of my unrelated children have been diagnosed with thyroid disorders and other disorders associated with PFCs. The precautionary principle to risk management states that if an action or policy has a suspected risk of causing harm to the public or to the environment, in the absence of scientific consensus that the action or policy is not harmful, the burden of proof that it is not harmful falls on those taking an action that may or may not be a risk. This concept implies that there is a social responsibility to protect the public from exposure to harm when scientific investigation has found a plausible risk. These protections can be relaxed only if further scientific findings emerge that provide sound evidence that no harm will result. Here in Merrimack, a citizen-led health survey and small random blood testing sample have shown that Merrimack residents have been and continue to be impacted by air, water, and soil exposure from PFCs from St. Gobain. Our public and private water is contaminated. Our town and state government must advocate for, and St. Gobain be held accountable for, the health and well-being of all of us as it pertains to PFAS. It's my understanding that Hoosick and Petersburg, New York, asked St. Gobain to filter school wells tested at no detect and 12 ppt and got it. Windham got bottled water in schools at 20 ppt. Amherst, 100 residents got filtration and Pennachuck testing over 40 ppt. As regards filtration of our public water supply, now that the blood test data is in, and we know that it will take time for science to prove health correlations to PFCs, does the Merrimack Village District endorse a wait-and-see philosophy, or would they prefer to filter our water to be sure we're protecting our children, as other communities have done by adopting a precautionary approach?
We are, the Merrimack Village District is governed by standards. We're following our standards. Our water is within compliance. That we're putting out. The only 2 wells that have exceeded are shut down, and will be hopefully online here pretty soon once we've finalized the negotiations and get some treatment in place.
So the answer is no.
We follow the standard. The standards are 70 parts per trillion. We're well within the standards set by EPA and the state guidelines, and that's what we're governed by.
Right, I understand that 70 parts per trillion is a state guideline currently, which I hope our state moves to change, as many other states have done. So rather than take a precautionary approach and risk continued harm to our children, look at Reed's Ferry School, the closest to St. Gobain, and they're higher. Well, I live right by Reed's Ferry. I mean, it doesn't take a rocket scientist to see the correlation between proximity to St. Gobain and look what's happening to people's bodies. We know science takes a long time. It's going to take a long time to prove correlations with specific diagnoses and illnesses. But in the meantime, we're the guinea pigs. And we know St. Gobain has left Vermont because we know there's been an expectation that they become more environmentally friendly and aware and conscious. And they came here, and I'm not sure that other than a state guideline of 70 parts per trillion, that there's a lot, what's the expectation in terms of our water's contaminated, our soil's contaminated,
Michelle,
our
I'm going to
air is
ask you to wrap
contaminated.
up, please.
Pardon me?
I'll ask you to wrap up, please.
Yes. So that's my question. Are you willing to take, I understand the town council has no authority over the water that every resident in town has to drink. We don't have other options unless we buy bottled water. It's up to you guys to do the right thing. Take a precautionary approach. Not just count on diluting water down. Our water is contaminated, whether it's 30 or 40 or 70 parts per trillion. That's not supposed to be there.
Thank you, Michelle. Mike, I assume you want to address the school question.
Yeah, it's Michael Thompson. I just want to clarify the Reed's Ferry comment. The water levels that were higher was due to the proximities to wells 4 and 5, due to the water being located closer to school. Since that has actually been shut down, the water level, the contaminants within the water are actually in close proximity to the other schools at this point.
Thank you. Diane? Go ahead, Mike.
The school board is looking at additional tests coming up shortly. The numbers, and I do not know them off the top of my head, but I believe that they were below 20 parts per trillion the last time that they were. I'm just stating the facts, that's all.
All right, Diane? And then, looks like maybe Nicole Tonaselli?
Hi, I'm Diane Link. I live on Parker Drive. I've been here for 25 years. We're on Merrimack Village District Water, and my husband and I both had the test, and I expected to see nothing in our blood sampling because we drink filtered water, bottled water all the time, we lead a healthy lifestyle. So I was a bit surprised last night to get that. But what really concerned me was yesterday I babysat for my grandson. Beautiful, like other people, everybody has great families, 8-month-old baby. And when we were giving him his sippy cup water, we made sure to use the filtered bottled water. And then when we made his formula, I took it from the faucet, our filtered water, but it's got the carbon activated, which I had heard was a good thing. But now that I have double what you're supposed to have, and I'm on village water, and I use filtered water, it doesn't seem like that is effective for the people on Merrimack Village water. And maybe we need to put some sort of, everybody's been talking about a label on here, this water might not be good for your health, even if it's on Merrimack Village District water, because I have double, and I live a good lifestyle, So what I really, came here this morning and I was thinking about this, and what I wanted to find out is like, are we notifying the other people in town with little children? Make sure when you mix your formula that you're going to be using bottled water, because if you're on Merrimack Village District, you're not sure that you're going to have good water for your child. That to me was a light bulb went off, and I was very upset about that. And when I rinse off his toys, which are constantly in his mouth, I guess I should be using bottled water to do that because he'll ingest it that way. Even when I got my new couch, I made sure I don't have a Scotch Guard on it. So we are trying our very best to do and eliminate all the sources, but I also worry about the rest of the families, the young families in Merrimack. And I think we need to educate people in Merrimack with young families and little children, especially because at least they're not contaminated. I may be, but I don't want all the children to be contaminated. We should do something.
You're the one I butchered the name on, I guess.
Nicole. No,
Okay.
you were right. You were good.
Okay.
My handwriting's not the best. So Nicole Tomaselli, I live in Knollwood Drive. I'm like Kathy, and almost our entire neighborhood is here, I have to say, because we're in that contested zone. One thing, and I've spoken with Jim Martin, I feel like I have a personal connection with him. He's been there he is. Thank you, Jim. You've spoken to me and heard me many times now. I want the DES to ask us what we want. Those of us that are on private wells, I definitely don't want to be an MVD customer, I'll tell you that. I am not interested in buying their water. I don't want it. They didn't detect it. How pathetic is it that the company that's causing the contamination is also self-revealing, has given millions to other towns, yet our own town has gotten nothing. Nothing done in a year and a half, and it is unacceptable. I have 2 small children. They go to Reed's. I send them every day. Now we bring our Merrimack, our Monadnock bottled water every day. And I do want to acknowledge the tremendous amount of work that you have done and the data you've been compiling, and I know it is not easy on a government organizational kind of budget. However, we just got water on September 17th, so I don't want us touting all these successes when we are just getting water. It's been a year and a half. Our well tested at 62 parts per trillion. There are so many battles here and so many layers. What I want as a private well owner is a point of filtration, and I want it now, and I want filters for the duration of that home, and I want regular testing done every single year to ensure that those filters are keeping up with these unknown emerging chemicals. That is the only answer for me. I am not interested in MVD water. No, thank you. And I feel very bad for the friends and families we know that have to pay for this water every month because it's a monopoly. And I know if they had a choice, they would go elsewhere. Thank you.
Michael?
Michael Thompson, 99 Joppa Road. I have a question in regards to the data that you provided in regards to the average PFC levels by community. By reviewing the numbers that we actually studied for our blood tests within Merrimack, I'm trying to understand what the margin of error is on every single one of these tests to actually be able to decide whether they're actually comparing numbers to numbers. So based off the sample size of a place like Merrimack, with a 95% confidence, you might be at 7 or 8% error on the test that you provided to this community. So the question would be, is that data available, so the margin of error and the confidence levels for every single one of these towns? And then additionally, when you're talking about the US population in 2011, 2012, what percentage of those people that were actually surveyed in those studies were actually from the 3M plants, the Ohio River Valley, and were they skewed or were they actually taken out of the statistical norms within those studies? So looking at this graph, it doesn't tell me anything without that additional information. It looks pretty because we're all within certain ranges, but looking at it, it doesn't tell you the full picture.
Yeah, that's a good question. I think this comes down to how to message and interpret some of this data. I mean, we can throw, as you mentioned, like confidence intervals around some of these numbers, but that type of message and graphic isn't interpretable by most people. And so, what document are you looking at? Are you looking at the so there's another summary document which we have over here, which is an overall summary which compares levels between the different communities, and we've tried to help interpret what the levels mean in some of these documents. So regarding your question about are there confidence intervals, I'm trying to think if we have that on our data website. One of the links up here had more information about specific levels found in the various communities tested. Above and beyond these handouts, that includes the PEAS 2015 testing, the PEAS 2016-17 testing. The Southern New Hampshire, we're going to have the MVD data points up on our data website in the near future. So there is more information on the data of this that will be put on our website, but we try to summarize it in these documents. Regarding your question about the comparison to the U.S. population data, that's also a very good question. And you can actually go online to the CDC website, which is the organization that conducts the national biomonitoring, the national blood testing. The CDC performs what they call the National Health and Nutrition Examination Survey, or the NHDES study, where they go around the country and they randomly sample and randomly select individuals from around the country to do a huge health survey. That includes looking at like heart disease and diabetes and blood pressure, and as part of that they also collect tubes and tubes of blood, and they run chemical analysis on the blood to see what kind of not only medical biomarkers people have but also chemicals. And so a lot of their methodology is described, you know, through their website. So if you're interested in more information, but the U.S., the general U.S. population are randomly sampled, random sampling of the U.S. population that don't have any specific known exposure. Now, is it possible that some individuals have, you know, are drinking contaminated well water? That's certainly possible.
So I'm really just focused on the graph and the statistics within this. If any mathematician were to look at this, they would throw the graph out because it doesn't give the full story. And that's what I'm asking you to do, is give the full story.
Well, so these graphics aren't meant for statisticians and mathematicians.
Well, then it's misleading to individuals that look at it quickly. If someone would look at this, oh, look, we're within norms, we're good. But are we? That's what I'm saying. So to me, just these graphs don't tell a good story. They don't give all the data.
Okay.
And if you can't have each one with 95% confidence in an error margin of 2, then none of them should actually be on the same graph. That's what I'm trying to say there. That's what he's saying we can.
So you're asking for the confidence intervals around this.
What I'm saying is if one confidence level is 95%, the other one's 99%, and one's an 8% error and one's a 2% error, they shouldn't be on the same graph. That's what I'm saying. So and then I just have a follow-up question for the MVD.
Yeah.
Have you inquired with your customers to see what they want for a level within their water? Not the state, but their customers, because that's what matters, not the state.
We have not yet. That's something we probably can do. We can have a questionnaire or something.
I would recommend it because I think that would be a better gauge of what you should be doing as a company that is serving water to the public. Not the state, but the actual consumer of the water. So please do that. Thank you.
I have two more that have asked to speak, Carol DePiro and then Dennis High.
Hi, my name is Carol DePiro, and I want to thank everybody for coming tonight and spending the time talking with us. We appreciate it. I've rewritten my question probably 5 or 6 times because people have asked things that I've been thinking. So I'm just going to try and summarize and then ask a question. Can we please, a gentleman, Wolfram, suggested a council of some sort, DHHS, DES, MVD, town council, citizens, working together to solve this problem. Let's figure this out, or are we at the point, and include in that state legislation, because I don't know what's going on there, but it doesn't seem like there's a lot of concern for the people who voted them into office, and now there's people all over town getting sick. I have seen and heard too many personal stories, and unfortunately, a lot of it has been confided in me. You talk about emotional trauma and stress. I have lost so many nights' sleep over this stuff. I have a child born and raised in this town. I know lots of kids, little kids. I know people whose kids are sick. I mean, are we at the point where if we can't negotiate clean water, do we then, as Bill Boyd suggested, get counsel? I mean, the longer this goes on, the more exposure is happening. I don't understand why we're not working towards resolution of cleaning up our water when Bedford doesn't want to hook up to our water because of the level of contamination. That's why they're not hooked up yet. You need to ask your customers what we want, and maybe people are willing to pay a little more. I don't know. But I want clean water. I have lost so much sleep worrying about my child and kids all around this town. It's time for action. There's just too much to say. So where do we go from here? Because there's too much finger pointing. I heard the same excuse a year ago between the town council not controlling MVD. Who is going to take ownership of this? We need a resolution. We just can't keep letting time go by and children grow up with carcinogens in their body. You know, it's going to take 10 years to prove all this. What are the answers? How do we move forward? What suggestions do you have?
Thank you, Carol.
No answer.
Dennis?
Hello, Dennis High, 36 Bedford Road and 41 Bedford Road. So my parents and my house, or our private wells, they tested at 190, and that was at 110 feet, and then mine was a 600-foot well, and that was at 210. On your slide, you had in the 2005-2006 summary with the 3 EPA scientists reviewed, you had like the not likely and the probable, right? One of the things that you showed was that one didn't have like a kidney disease, right? But then on the other one you had thyroid conditions. So the renal development, I guess, and I'm no doctor, but the renal development can occur, and then it also affects the, I guess, the glomerular filtration rate, GFR, for the thyroid. So
wait, I'm sorry, I'm not understanding. Can you?
Well, I guess what I'm trying to understand is, one says it's probable for thyroid issues, but then on the other one it says that like kidney issues, kidney disease is not likely. But I guess thyroids with the renal development with the kidneys and stuff, that can cause issues between the two interactions.
So the two aren't. I'm not seeing the connection I think you're trying to make, because the thyroid disease is separate from what's been studied around kidney disease.
Okay.
You know, there have been studies that have looked at kidney function, just like there have been studies that have looked at thyroid function, but they're two different health endpoints that have been evaluated.
Yeah. So, well, I guess what I'm trying to get at is that most people here are not townies, right? So my father's been in town since he was 7. So when the town was 500 people. They've lived on Bedford Road since 1964, 65. So we're within the 1.5 mile radius, right? And their well is, 190. So, both my parents are having, stage 3 kidney issues, and then thyroid issues. So I'm trying to understand any correlation between them. That's one question. And then the other thing is that I think that Mike guy brought it up too, is that you showed the 2005-2006 summary, but you didn't show any of the competing testing that had discrepancies. So you kind of took the 2005-2006 stuff as gold, but then any of the other competing ones that had, the discrepancies where people weren't getting along and didn't agree with the results, you didn't highlight any of those. So what were the differences that the 3 EPA guys didn't agree with the new studies that were happening?
Well, so I think, so two comments to that. And I understand your question and concern about, seeing health impacts in your family. And wanting to know what the connection, if any, is, and that's completely understandable, and unfortunately not something that you know, we don't have a crystal ball to be able to say whether or not the exposure was connected to your family's or the health problems that you've seen in your family.
Totally get it.
And I get that that's unsatisfactory, and that's a difficult position that I know you're in. It's a difficult position that we're also in when we try and answer questions around, you know, people have real and valid concerns, and they're seeing, you know, real health impact in you know, family and friends, and want to know why. And that's, I think, an understandable question, and unfortunately not one that we have an answer for.
Well, I wouldn't even be tying it together had you not
Going
showed
back
it
to
on
my presentation,
Right. So, you know,
it's hard. It's very difficult to try and summarize the science around this, and this is something that we have struggled with over the last 3 years of going out and talking with communities. As I've mentioned, the C8 health studies are the health studies that people know about the best. They're some of the largest of environmentally exposed communities. But when you start looking at the science as a whole, there's multiple studies of different populations looking at specific health outcomes, and to try and do any kind of synthesis in a 10-minute presentation is very difficult to do. Oh, yeah. So what I've tried to do is twofold. One is to highlight the ongoing areas of study that are occurring around those health outcomes that are getting more attention. You know, and there's, for some of these health outcomes, there's more evidence than for others. And I highlight the C8 health study because there's a lot of focus around that particular health study. You know, this was conducted a number of years ago, and it's still valid, important science. But at the time when they produced these link reports, you know, they studied their population in the Mid-Ohio River Valley area, and they studied the science that was known at that time. Much of which was looking at workers exposed, you know, occupational exposures. You know, over the last 5-10 years, there have been many more studies that have come out, and those studies, you know, they vary by, you know, studying the Swedish population, studies in, you know, other countries around the world, studies in other populations in the United States. And so it becomes very difficult to try and sort of, in a very succinct manner, synthesize all that information. You know, I think a lot of this started, though, with the C8 health study, and that's part of the reason why we highlight the findings of that study.
No, that's fair. So just real quick, the other thing is that of the 1.5 mile radius, so that's been kind of the sweet spot now, I guess, right? So of Saint-Gobain.
Well, so just to clarify, the 1.5 mile radius was, I think, a little bit of an arbitrary demarcation. I think as DES mentioned, when they first went out and were doing their investigation, they started at 1/2 mile, then 1 mile, then 1.5 miles. And so when we were looking at how to analyze the data, we had to, you know, there's not like a clear answer, or, you know, if you're within 1/2 mile or more, you know, it's not clear where that line is, and so the 1.5 miles is a little bit of an arbitrary cut point. You know, it doesn't mean that somebody that is 1.6 miles from the plant, for example, may not be exposed to higher levels. We don't know, and that's something that we need to investigate further.
Right. Yeah. So, you know, we're within 1 mile, right? So when you first did this, you know, 3 years ago or whatever, you know, we were on the line and we were kind of missing it, but, you know, I talked with you guys still came out, and then, you know, both of our wells were really high. But out of the 200 blood samples, did you take out the low liars, you know, to try and get, you know, some of the numbers just within the 1.5 miles to maybe chart it different to see what shows up?
I'm not sure what you mean by take out the low liars.
So, you know, like the numbers that, you know, like if the numbers for people's blood results that are beyond 1.5 miles, you know, of the 200, if you got 50 within the 1.5 miles, and, you know, what were those numbers compared to the nation's results in 2011 and 2012 and things like that? So just within the 1.5 miles, what were those compared to 3M and the other areas and all that stuff?
Yeah, well, we tried to make some of those comparisons. Again, we were a little bit limited. So one of the final tables, we have the number of people and some of the levels that were seen for people that lived within about 1.5 miles or so of the plant.
Yeah.
So, you know, we didn't make the comparison directly to those who live within 1.5 miles of Saint-Gobain and other tested populations. But the numbers are, and we will make these available on the slides. You know, I believe that the average PFOA level was about 6 for those that lived within 1.5 miles of Saint-Gobain, and many of the other exposed populations around the U.S. that were tested, like Vermont, New York, the C8 population were, you know, on the order of 10 to 30 plus PFOA on average in their blood.
And then did you do any cross-references between MVD source and well only for the 1.5 miles only?
Well, so some of those analyses I think you're asking about are one, limited by the small number of people within that geography, but that's partly what we need to go back and evaluate more. You know, this was, we were wanting to get the results out, we were wanting to provide information to the community, but we realized that we have some further sort of digging to do around this particular issue.
I think actually, so this study, everything presented tonight, nobody's on well water. These results were strictly for people on MVD. The Southern New Hampshire investigation, those are only people on well water. Nobody in that is on MVD. So if you want to look well versus MVD, look at the Southern New Hampshire group. That's all well.
Yeah.
It's Litchfield, Bedford, Merrimack, and Manchester. And MVD is just people on MVD system, nobody on well. So that data is in what he presented if you go back and look at it.
So this on the slides that he presented?
Yeah, the Southern New Hampshire did not have a delineation of 1.5 miles from the facility because the levels in some of the wells were so high.
Yeah.
Some in Litchfield were over 400 that I think it would have been hard to do some of the analysis. Plus, there is a lot of sensitivity. For instance, we don't see any of the individual blood results at DES. We're not HIPAA cleared.
Right.
And so there is a goal in these to not have it where somebody can go into the study and say, oh, Tom Smith, I have his blood results.
Okay, so then I was misinterpreting it.
Yeah. So I was starting to see the confusion.
Yeah.
And the results of MVD are 100% MVD. The Southern New Hampshire investigation is 100% well water, nobody on MVD.
Okay.
And I'm sorry, I probably didn't completely understand your question, and I have a hard time hearing with the echoing in here, so I apologize if I didn't pick up on what you were asking.
No, that's great.
I will say, if you're interested in the private well blood testing results, all that information also can be found through some of the resources that we've linked.
So now this has been going on for like 3 years now, right?
No.
2? I thought I heard 3 years earlier.
Less than 2.
Less than 2. Oh, okay.
Well, PEAS, yeah, I'm sorry, PEAS.
Right.
Thank you. PEAS has been going on for 3 years. This area, I assume the question was in this area, has been less than 2 years.
Okay, so this has only been...
Thank you, Dennis.
All right. Okay, great. Thank you very much.
We had one question, Dr. Chen, I believe I gave, Clark.
Sorry, I got to put my glasses back on.
I'm going to let Clark respond to this.
So the question is define lifetime exposure and when does it start and when is it based upon? So in the case of the Lifetime Health Advisory, which is what the EPA put out last May, that is a 70-year window. It starts from whenever you begin exposure to whenever you cease exposure, an assumption that between the two endpoints is 70 years and no longer than 70 years. So if you start in utero, say -3 months, it would go to 69 years and 9 months. After that, it would be outside of the exposure length that was assumed in the models and in the data.
And what would your blood, at the end of that, how much would your blood?
I don't know what the blood serum levels associated with that are.
I'm not sure. I don't know.
It might be interesting for the people that have been measured to see where they've
I don't know if that data is out there for the lifetime levels.
Honestly, it's a good question. I'll be glad to look through the health advisory that the EPA put out to see if that data is in there. I don't remember seeing it in there, but it's an interesting question. They did it really by health outcomes, and again, the linkage between any individual serum level and a health outcome, that's really not pinned down. But I'll be glad to look through it. It's a good question. Thank you.
The data that is out there are around that particular question are in regards to these communities that have been exposed and studied. So like the C8 population, where they have actually, they know the level of PFOA in the water, and it's always hard to say what somebody has been exposed to in the past, what levels, for how long they've been exposed. But these are the type of studies where they do very extensive modeling, scientific calculations to computer modeling to try to make some assumptions and determinations about how long somebody was exposed for, and then they can look at the exposure and try and make connections with the blood levels. But I'm not aware, when the EPA set their health advisory level, it was based on very well controlled animal studies where they fed animals like rats a known dose, a known quantity of PFOA, for example. They followed them, for the animals for health conditions, and so based on, at varying doses and based on the lowest dose where they either saw a health effect or saw no health effect, they came up with these calculations for what they call a reference dose, and then went through a bunch of correction factors to make it applicable to humans. So I'm not aware. I don't think there's probably. I mean, we can look certainly.
I'd be glad to look.
But the way that these are developed, I'm not sure that it would take some calculations and modeling to come up with, I think, that answer, and I don't know that we have the data to do that.
People have anxiety about the
Oh, yes.
Yeah. No, of course you do. And like I said, it's a great question. It's not, I don't remember reading it, but it doesn't mean it wasn't in there. And I could certainly ask our environmental health advisors to take a look also.
Yeah.
And what might be interesting is, like I said, Minnesota went a different route, and they have a nice budget and some people who can do this. They actually came up with a pharmacokinetic. I'm an oceanographer. They have a model of how the chemical goes into your body, where it goes in your body, how it resides in your body, how it gets out of your body. And then they use that to come up with their new standards for the two chemicals, which, if you add them together, is close to 70, but individually is much lower than 70. We're trying to understand that model, and what might be interesting is if that model does get validated with some ground truth, because right now it's been run, but there's really no data to run through it to see if it's accurate. If it does really prove out, it'd be a great way to go answer those kinds of questions, that if you started exposure at this age and maybe you were exposed at a higher level and then you got down to 7, where do you, reasonably, what should you expect? So you could look and say, is there something else going on in my life such that I've got this unusual result in my blood serum? It's a fascinating question. So, then why didn't you ask it?
This is a gentleman who generated the question.
Oh, okay.
My name is Jeff Daly. I'm from Nashua, and you know me from past. One of the things that has not been discussed here tonight, Dr. Chen, is bioaccumulation. I have had long discussions with the CDC, and I mentioned this to you the other day. CDC basically disagrees partly with the EPA data because they don't take into account bioaccumulation. The gentleman who just said his well measured 190 parts per trillion. If his parents were drinking that in, and we talk of half-life, through excretion and what have you, what percentage is retained in the body as a bioaccumulative material at the various organs? And that's what the CDC is now examining along with the Minnesota people. And it needs to be clearly brought out so that everybody understands it's not just the ingestion, it's the bioaccumulation. So shall we say you drink water that's got 10 parts per trillion, you may excrete X percent. So you're still left with X percent in your body, or Y percent, sorry. You drink another drink, you just keep adding it. And one gentleman at the CDC said, all right, shall we say 10 parts, you excrete 9. So you're left with 1. Then you do the math. He said within 30 years, you would have exceeded the 70 parts per trillion very quickly. Now, if it's in vitro, it could be in less than 20 years through bioaccumulation. And that's something I think that everybody here on this panel needs to look at and take into account, because the CDC right now is looking at it.
Thank you.
Thank you.
Chris, did you want quick? So we can wrap up here?
Thank you. I know it's late. I'm Chris Christensen, State Representative from Hillsborough County, District 21, which is the town of Merrimack. Thank you very much. And I'm going to reserve 30 seconds at the end for Bill Boyd, who also wants to speak. I just have a couple of quick things to clarify. There is some legislation pending on both air and water conditions. There was a bill that, and I went through this in detail with the town council. You can look at their last meeting that I was speaking at, but I know it's hard to dig it out of the agenda. There's a committee been working on that, met 3 times in the last 8 or 10 days. They'll have a report out and a suggested program by November 1st, and we'll look forward to that. I can give you more detail, but I'm not going to do it now. There are a couple of MVD commissioners in the audience, and I hear a lot of information back and forth that tells me the audience really isn't familiar with how the MVD operates, that it's a separate governmental body. And the suggestion to the commissioners is that you move your meetings from the MVD headquarters to the Matthew Thornton room, put them on TV, or maybe hold them at night when more people can come. Thank you.
All right, Bill.
Thank you, Madam Moderator. The question's for Director Potter. I wanted to just circle back very briefly regarding the medical monitoring piece. I appreciate the fact that DHHS has engaged in a relationship with New Hampshire Medical Society. But I would also point out that there's a lot of medical societies that exist in the state of New Hampshire. Bi-State Primary Care, New Hampshire Osteopathic, New Hampshire Pediatric Society. There's a lot of similar medical organizations in the state that are similar to the New Hampshire Medical Society that advocate for the doctors that pay their fee into that particular system. In the handout, one of the things that was talked about is for people that when they go to their medical provider to make an informed decision. Well, it's difficult when there are people that don't have access to being able to get their blood tested. And I understand, and I don't like it, and to be candid with you, that people aren't going to be allowed to go through the state to be voluntarily blood tested. But what you should be doing is you should be accessing the list of medical providers that have to get licensed by the state of New Hampshire. You have nursing professionals, you have doctors, you have allied health professionals, and osteopathic doctors that get licensed every year in the state of New Hampshire. It is very easy to generate that particular list, send out information regarding PFCs, and to introduce them to the 2 or 3 labs that can provide testing to people that really want to be tested. I mean, we need to be empowering people to make their own choice. And if you're asking them to be a part of the medical process with their primary care physician, then you need to give them access to that. I'm not asking you to pay for it in a Trump world. That's probably worthwhile. But if people, like Mrs. Ricker said, if she's willing to shell out the X number of dollars, then I imagine that there's other people in this community that are willing to pay the dollars so that he or she or their family member can be adequately tested for these particular toxins that are in this system. So I would encourage you to reach out to the medical community like you've begun to. Have an honest conversation, train them, explain them. You've trained us tonight with a lot of data here tonight. My wife's a nurse anesthetist. She's the smartest woman that I know because of what she's been able to do with her career. People in medicine are smart. They know how to do it, and they know how to best advocate for their patients. So I would encourage you to use that medium for them so that medical monitoring can occur and allow people to be empowered to make their own decisions as to what they need to do. Thank you.
Thank you. That's very helpful. Thank you very much. What I hadn't thought about is, many of those organizations that you named, we have relationships with for various work that we do. But what we need to do is sort of cross-contaminate, or cross-infiltrate, and that we may talk to the Pediatric Association about one particular issue, but we may not be talking about all the issues that we need to talk about. So I think that was a very helpful remark, and I appreciate it.
To include in the what?
If people voluntarily get their blood tested, can you include that in your data?
I don't see why not. Well, so there, right. So when we do the blood testing, we also send out a questionnaire asking about different types of exposures. I think it partly depends on where people are coming from. So, when you ask, for example, in Merrimack, if somebody gets tested in Merrimack on their own and shares the data with us, can we include that in our MVD exposure assessment? That becomes a little more tricky because the way that the MVD exposure assessment was conducted, it was intentionally random. So that the findings could be made sort of generalizable to the rest of the MVD population. And so to add additional results in for individuals that self-selected would change the purpose or the results. Now, that doesn't mean we're not happy to look at them. We would be happy to sort of look at results that people are interested in sharing with us. How that gets incorporated into the existing data, I think, is still up for discussion. So if somebody like in southern New Hampshire who's on a private well gets tested on their own, that's a different type of testing we're doing for people on private wells than what we've tried to do for the Merrimack community. So you're asking about is somebody taking the results and doing a health study with it? So we certainly have a cancer registry which tracks all residents of New Hampshire that have been diagnosed with cancer. That cancer registry doesn't take into account exposures like PFOA. On the other side, we're looking at exposure, by doing blood testing, but we haven't collected information from people about whether they've developed cancer or not, as an example. So, I think it gets to the question of how best to conduct a health study for people that have been exposed to PFOA, and that is still something that we're in the process of trying to sort out and talking with, like ATSDR and some of our federal partners about to try and, get something like that conducted on a national level where I think there's more power, so to speak, larger sample sizes is more likely to show findings and conclusions that would be, applicable to across the United States.
Clark, I'm going to give you just a few minutes to kind of wrap up here.
So I appreciate everybody coming out and the feedback we got in advance and the questions during the meeting. We are trying to continue the dialogue through these meetings, town council meetings, the various coalition meetings we've been asked to go to. I definitely got the call that we try and figure out some way to set up a panel. Like I said, I would like to try and figure out how to not do that town by town by town when I've got one responsible party down the street. I'd rather do it that way, but we'll try and see if there's some way to do that makes good sense for all parties. We really appreciate your engagement. My original boss, Tom Burek, when he was commissioner, was here for the very first meeting, our kickoff in our first discovery of this, and he made the comment, none of us want to be here tonight. I know you don't want to be there because you don't want to have this in your life. We don't want to be here because we don't want to be the one that's bringing you bad news and not getting you the good news as fast as you want it. Trust me, I know you want results faster and you want better results, and no matter what we do, it's probably not enough because somebody does have a health outcome in their family and they're concerned about whether these chemicals have something to do with it. We got families, we live here too, and we know that. And I wish we could give you the perfect answer you want. I can't. But I guarantee you we're working hard to try and make sure we know what the extent of these contaminants are. We're trying to understand the best science available. and we're trying to work within the limits we have to regulate and get budget to help answer questions and get you what you need. Like I said, we appreciate the engagement. The town's been great. We keep thinking we've hit the end of our answers, and somebody finds more wells for us. They find more samples. They go out and do a survey. We really appreciate you helping us. I'm sorry we haven't gotten you answers faster, but we are trying to get you to better answers soon.
Lisa, one final comment here.
Yeah, you know, I think, as I had mentioned when I first started speaking, is that really these kinds of dialogues are so helpful for us, and I hope for you as well. And I think that the idea of an ongoing dialogue is vitally important. We have to figure out the structures that are going to work to make that happen. And I know for us that, you know, we need to get better with our communications, with being able to speak in such a way that's understandable, and that's hard when you're talking about science, right? So we're really trying hard to do that, and to figure out how to best communicate, and we'll do that with your help. So thank you for having us tonight, and I look forward to continued conversations.
And just one additional point, this has been recorded tonight, so it will be transmitted on cable TV.
Good.
Thank you all.
Thank you.
Thank you.
Oh, wait a minute. I keep saying one more, and one more keeps showing up.
I just wanted to make sure. Carol, where is she? Did she leave? Oh, there she is. You heard crickets. You said you heard. No. We respond. We already have a person designated for you guys. We want to be involved. Bill Boyd is at the liaison. Get him involved. I've already touched with, well, you talk with MVD. But just to also let you know, I've already talked to Lisa, and we're going to be working with DHHS to see what kind of things the town can do to advocate with them as well. So that's the stuff you can communicate with. Fine, go for it. Thanks.
Thank you.